Honorable members, at the suspension, we were debating a compendium of medical bills. I presume we are now ready. As many? The chair recognizes the honorable member for Central and South Eleuthera.
Thank you, Madam Speaker. I rise today on behalf of the great people of Central and South Eleuthera, who I've had the honor of representing in this House for almost 4 years. And I rise today to support this suite of legislation brought to this honorable House. That is not just a policy update, but it lays a framework for serious health care amendments throughout the Bahamas. Madam Speaker, I don't intend to be long because the Member of Parliament for Tall Pines, the Member of Parliament for Golden Gates, as well as the Member of Parliament for Cat Island, Rumkey, and San Salvador, expanded what these 5 compendium of health bills is all about. So I'll speak briefly, Madam Speaker, but I had to provide my support today for these bills because health care throughout this country is extremely important, especially for those in the Family Islands. These health bills, Madam Speaker, is a bold step towards health care to make it more accessible, equitable, and responsive to the realities of every Bahamian, especially those who live on the Family Islands. And Madam Speaker, I do so with deep appreciation, not just as a minister of the government, but as a proud son of the Family Islands of Eleuthera, where I still reside and raise my own family. This legislation strikes at the very heart of long-standing inequality in our healthcare system, and it brings into focus what we, as Family Islanders, have always known, that healthcare access cannot be a luxury. It is a necessity. This is a step in the right direction, Madam Speaker, and this compendium of bills will significantly change lives across our country. And let's be honest, for far too long, access to quality health care might seem and has seemed far-fetched for Family Islanders. We've always heard stories about the challenges of traveling to New Providence, access to pharmaceuticals, but these bills ensure and enhance health care and connect our healthcare system throughout the country. For decades, residents of Central and South Eleuthera, like so many Bahamians on our Family Islands, including Andros and Cat Island, Acklins, Mayaguana, Axuma, and the like, have had to travel to Nassau for dental services, in some cases prescriptions, or specialist care, often at great financial and emotional costs. We are changing that, Madam Speaker. And this compendium is more than legislation, it's more than policy. It's a signal to every settlement, key, and community across the Bahamas that your health matters too. Whether you live in New Providence or on Ragged Island, in Long Key or in Lower Bogue, we are saying, this government is saying that you deserve safe, affordable, and accessible health care. When we look at the Dental Professions Bill 2025, we look at closing the gap. This new legislation modernizes and strengthens dental practice regulation for the first time in over 50 years and replaces outdated legislation, introducing a comprehensive system for licensing, registration, and accountability in dental services. It creates a robust licensing and registration regime, ensuring that only qualified professionals can operate. No more loopholes, gray areas, unregulated clinics flying under the radar. Madam Speaker, this isn't just about professional oversight. It's about protecting our people. This is real protection, especially for persons who may not have the resources to verify credentials or fly to the capital for a second opinion, because we've seen, even in the capital, individuals being prosecuted for posing as dentists without license. Sometimes, I think Minister Dawa said one of them was pretty good. But it raises the risk of patients being harmed physically and financially. And this bill will help to detect and prevent and punish those scams. So this bill will bring much-needed regulation to a profession that has long operated in silos, and patients can now trust that their care will be current, credible, and safe. Madam Speaker, when we look at the NHI bill, it is equally transformative. It repeals the 2016 legislation and replaces it with a more efficient, accountable, and family-focused framework. And this bill reimagines NHI to serve all Bahamians more effectively. And importantly, the authority will now have more teeth to ensure that accredited providers deliver safe and quality care, whether in Nassau, Gregorytown, or San Salvador. And this bill opens the door to universal participation and universal protection. It is the kind of reform that will impact a young mother in Greencastle, a diabetic in Abaco, or a retired teacher in Crooked Island. Madam Speaker, overall, the NHI Bill 2025 establishes a stronger, more autonomous NHI authority. And for Family Islanders, this is a game changer. Madam Speaker, preventative care is extremely important. It protects against diseases or sicknesses prior to the need for catastrophic care. When we look at the pharmacy bill, this, Madam Speaker, bridges the old and new, in short, but important bill, and introduces modern prescription protocols, bringing clarity and modernization to our prescription systems. This is critical for reducing errors, improving oversight, and eliminating abuse. And again, Family Islanders stand to benefit. Imagine a future where your physician in Rock Sound can issue a secure digital prescription, and your pharmacist in Governor's Harbor can fill it with confidence, without delay, without confusion, and without compromise. You know what's interesting, Madam Speaker? Today, I must have spent about 30 minutes on the phone with my wife trying to sort out a prescription for something as simple as blood work for my son. You know, you live in islands where blood work is inaccessible, like New Providence. So you had to get a prescription signed from your pediatrician. You had to send that to CALSO or whichever lab you're using, and you had to organize all of this. So, I mean, even that helps to touch the lives of people that you might not ordinarily recognize. Madam Speaker, these legislations, something as simple as the chronic disease prescription bill fund as well, directly impacts people's lives and can help save lives. It is legislation that speaks to the senior citizen on Long Island or the single father in the Barrys who wonders if he can afford the next refill. Now, Madam Speaker, health care should be absent of politics. I think all of us agree with that. I heard the opposition speak this morning about these bills might not be strong enough or don't go far enough, but Madam Speaker, that's what oppositions do. If legislation is pretty good, then you say it don't have enough teeth, it don't go far enough, it could have been better. But in any case, it's a step in the right direction. We are not waiting for the next crisis to expose the cracks. We are fixing the foundation now. And this is what good governance looks like. Planning, action, and delivery. Madam Speaker, and since we're speaking about foundations, no healthcare system can succeed without infrastructure. I want to commend the member for Tall Pines, who's done an exceptional job in ensuring that many of these clinics throughout the country has been renovated, constructed, built, reconstructed. I think in Eleuthera alone, probably looking at 6 or 7. You're starting out in St. Barnabas, Coconut Grove,
Yes.
brand new healthcare facility in Coconut Grove,
Yes, yes.
brand new
Results.
healthcare facility in Mangrove Key,
Yes.
and not only that, brand new healthcare facility in Eleuthera.
Yes.
And Madam Speaker, there's no way I could talk about the healthcare facility in Palmetto Point without raising the issue of the former administration canceling the mini hospital in Eleuthera.
No way.
Kalani, I don't blame you, because I know you speak after me, but I got an article here. This article is from 2012. No, you know, this article from 2012, where Dr. Minnis says it was an F&M's idea for a hospital in Eleuthera. So I don't blame you, Kalani. So you speak after me, I ain't blaming you. But so if you need me to table this, I can table that. But I got another article, Madam Speaker. You can Google it. It's Bombers Local. But this article is quite interesting. It's from March 12, 2018. And it goes on to say, Madam Speaker, how the former administration poked fun. And they said it says $500,000 for a hole in the ground. That's the name of the article. And under the Christie administration, the former PLP administration, they signed a contract for a healthcare facility in Eleuthera. For 5 years, Madam Speaker, they left the bills outstanding with the contractor. And when the member for Tall Pines was elected and became the Minister of Health, he ensured that they got their outstanding money. But what's interesting enough, if you read this article, it says, asked yesterday whether the government had made a decision on how it will move forward with the contract. Dr. Sands said, the former Minister of Health, well, let me put it to you like this. We don't have $27 million to build a clinic. So basically, that hole in the ground is going to stay there. What we may do, that's the former administration. See, and it's important for me because Central and South Eleuthera deserves the best. And they deserve health care. And it says there is no question that we have to improve the health care infrastructure in Central Eleuthera, but there is no point in me promising someone a Rolls Royce when I know we can't afford a Rolls Royce. I don't know why he was talking about cars here. Says, and a Kia will do.
Wow.
As a matter of fact, a Kia will do much better. But let me tell you, Central and South Eleuthera deserves a Rolls Royce, I can tell you that.
We know what they think.
So we know what that administration thought of Central and South Eleuthera. So I want them to know that thank you to the member for Tall Pines, the member for Cat Island, Rumkey, and San Salvador, because without this administration, the healthcare facility in Central and South Eleuthera would have never been built. And the block's going up, you know. It ain't just a groundbreaking. The block's going up. You'll see the roof on shortly. Things moving quickly. Things moving quickly. No. But I can tell you this. You could Google my page. Google my page and you can see where we're coming. But I just wanted to raise that, Madam Speaker. I'll table this because this is quite an interesting article. And I remember under the former administration, they even had the audacity, they printed these, you know, on billboards, and it came until I was poking fun about Eleuthera not having a health care facility, and didn't do nothing in Central and South Eleuthera.
You say nothing?
Nothing. Nothing.
You're mad about that.
I am mad. I'm happy now, though, Madam Speaker. I'm happy now. Madam Speaker, Angus straight, Madam Speaker. But during the reopening of the Nurse Susan Wallace Community Clinic in Black Point, the Prime Minister said health care must not be a privilege for the few, but a right for all. And he says we are not reopening clinics, we are reopening hope. And this is a sentiment that drives the government forward. We are building more than walls and waiting rooms. We are building a system that can help move the healthcare system along. Madam Speaker, as I wrap up, this compendium of bills before us today will change the way Bahamians experience health care. And that's not abstract policy. It's real impact. The young mother in Greencastle accessing a licensed dental hygienist. It's a senior in Rock Sound being automatically enrolled in NHI. It's a pharmacist in Governor's Harbor processing prescriptions electronically with confidence and ease. And it all signals a new chapter in Bahamian healthcare. One where dental services are safe and credible, health insurance is accessible and universal, pharmacies are modern, secure, and patient-focused, and one where no Bahamian is left behind simply because of where they live. To my fellow Family Islanders, help is not just on the way, it is here. To this honorable House, I say let's ensure that we support these. Kalani, you speak after me. He speaks after me. And he wants his road paved, Madam Speaker. So he could be.
Preempted.
Good move.
But you know, I'm proud to serve as a member of Parliament for Central and South Eleuthera. And I want to congratulate the member for Tall Pines and a member of Parliament for Cat Island and San Salvador for ensuring that health care is one of the top tiers on the list of this administration. Thank you, Madam Speaker, and I support this compendium of health care bills.
Thank you, Honorable Member. Asmini? Yes. Order the document be brought up? Thank you. Order the document to lie on the table. Asmini? The chair recognizes the honorable member for Kalani.
Thank you very much, Madam Speaker. Madam Speaker, at first I'd like to thank the member for Long Island who has yielded to allow me to speak, knowing that I have to leave soon to do my daily chores pickup. But Madam Speaker, before I get into debate, I want to remind all in here and in Parliament that Monday is Gambia Day, where Gambia have their usual activities, festival, all day food, there's entertainment, live music. It's in Gambia Village. And we're talking sense. Gambia Village in the great constituency of Kalani. And Madam Speaker, the festival or the activity will conclude with the members of the Saxons Junkanoo group who would close the event about 10 p.m. And we're making this a special occasion. We're hoping that families would come out and join the Saxons group and rush. I would be rushing along with the Saxons group. My wife will be rushing. My grandson will be rushing. And so will 8-year-old granddaughter who will be ringing bells for the first time. So I would ask many to come out and join us. It's a family event. And they would hear the Saxons group, part of the group, in preparation for their 6th straight. But Madam Speaker, I rise to make my contribution to this compendium of bills. But I will adhere specifically to the National Health Insurance specified chronic disease prescription drug fund. And I may just touch on the others, but basically I'll talk more about that. We have had a crisis of non-communicable diseases in our country for some time. And this is something that I have spoken about on numerous occasions, both as Minister of Health and as Prime Minister. And this crisis has been well detailed. As someone who has spent his career in health as a physician, I am alarmed at the state of affairs. Bahamians, Madam Speaker, are sick and dying in excessive numbers due to a series of chronic conditions that often go untreated or poorly treated. The main types of chronic non-communicable diseases are cardiovascular diseases such as heart attacks and stroke, chronic respiratory diseases such as chronic obstructive pulmonary disease, asthma, diabetes, and cancers. Our health profile is poor as a result of poor dietary choices and insufficient exercise. And Madam Speaker, that's why I want to congratulate the member for Angliston in bringing forth the National School Feeding Program. That was a program we spoke about, but I would ask her to go even further, the complete program. The intention was not only breakfast, the intention was lunch, and the intention was to include an after-school program. And that after-school program would have been academic, it would have been sports, and civic, and those were important. Academic, because you would know very well that many individuals in your constituencies and in my home and my birthplace do not have facilities to study after school or study at all. And that would allow them to receive assistance at school by professionals and at the same time complete their schoolwork. The sports program would have engaged them in active sporting activity and help with the chronic non-communicable diseases and obesity that we see. And then there was a civic program, and the civic program would bring in individuals to speak about many things: finance, savings, conflict resolutions, crime, laws, environmental matters, how important it is to respect laws, respect each other's, and whatever else. And the after-school program would have include a snack, because you cannot keep students there all day. So I would urge that you complete the program. I don't want any credit. I want a healthy nation. Madam Speaker, we have an obesity crisis, and this crisis is increasingly affecting especially our young people. We eat too many refined carbohydrates and high-fat foods and processed foods. We do not eat enough fruits and vegetables. And the prevalence of fast food restaurants in our major population centers is worsening the problem. And maybe the time we need to look at the possibility of enacting a law to ensure that no international fast food franchises are introduced, especially into our family islands. Nassau is contaminated already. Grand Bahama is already contaminated, but let us preserve the family islands and let us take care of ourselves. If we want to bring in foods, our own restaurants. Keep the McDonald's and Burger King that get us looking fat out. Some people eat 2 or 3 meals a day from fast food restaurants. Sadly, high cholesterol, high blood pressure, and obesity are the norms in our country. We are an increasingly unwell people. We are addicted to eating foods that make us sick. This lifestyle problem places significant burdens on our healthcare system. Our clinics and hospitals are filled with people suffering from the effects of non-communicable diseases. Healthcare budgets constantly have to be increased to try to be able to keep up with the number of people suffering these conditions. There are also losses to our national productivity and economy. And chronically sick people miss days of work. And when they are at work, they are less productive due to being unwell. We have to find interventions that help our people to make better lifestyle choices. While medications are important, we must also redouble efforts with the next generation, especially to teach them better eating and lifestyle choices. Initiatives are underway in the schools related to diet and nutrition. And again, I congratulate the member for Angliston. However, we may need an even bigger and bolder effort in the schools and education system to teach young people about healthy eating and the need for lifelong exercise. While the Bahamas has one of the worst health profiles in the region on these issues, there are challenges worldwide in dealing with non-communicable diseases. The World Health Organization notes that non-communicable diseases kill at least 43 million people in 2021. In 2021, 18 million people died from a non-communicable disease before age 70. 82% of these premature deaths occurred in low and middle-income countries. Of all non-communicable diseases, deaths, 73% are in low and middle-income countries. Madam Speaker, the Drug Fund bill before us seeks to provide for the establishment of a new fund under the control and management of the National Health Insurance Authority for dispensing prescription drugs and providing medical supplies to patients with specified chronic diseases. Madam Speaker, it was the F&M government that established the drug plan in 2009 when I was Minister of Health. But there was a special component within that plan that is very dear to me. There was a component called Healthy People component, and it's still there. But it was utilized very effectively. What that component allowed, individuals could have written to National Insurance with their proposal in terms of exercise, in terms of eating, proposals of keeping individuals healthy, hoping that they would improve their lifestyles and improve the quality of life. Once these programs were accepted, they were funded by National Insurance. And Madam Speaker, they were very effective at that time. In fact, there were quite a number of proposals that were accepted, and quite a number of individuals were able to stop taking hypertensive medication and was controlled just on food and exercise, etc. A number of people were able to stop diabetic medication because they, again, were controlled just on these programs. And that was a saving in terms of medication, purchase of medication, and also a saving to the health facility. And we face overcrowding, etc. But programs like this, which had a track record of being effective, should be continued, and that was very effective when Algernon Cargill was there, I think. So I would ask the minister to look at it. I think, when I think about it, I think it would be an excellent department within the drug fund to be run by some of our world-class athletes who want to return home. That would be a great opportunity for them to run the Healthy People program, analyze it, approve it, and ensure that it is effective. You can bring many of our world-class athletes back home. These programs normally have nutritionists and different things, and you would know, it's all there. With the passage and enactment of this bill, Madam Speaker, the National Prescription Drug Plan that currently serves more than 41,000 Bahamians will be administered by the National Health Insurance Authority. And the purpose of this act are to improve the accessibility and affordability of prescription drugs and medical supplies for the treatment of specified chronic diseases, to foster collaboration with partners and stakeholders towards the implementation of a national program for dispensing prescription drugs and providing medical supplies for the treatment of specified chronic diseases, to support the development of a formulary and to support the development of a national bulk purchasing strategy for providing prescription drugs and medical supplies. The authority may enter into a contract with privately owned registered pharmacy, medical supplies company, whether privately owned or not, hospital or a clinic managed by the Ministry of Health or the Public Hospital Authority, pharmacy managed by the Ministry of Health or the Public Hospital Authority, or a licensed hospital or a licensed clinic to dispense prescription drugs and provide medical supplies for the plan in accordance with the terms of a contract. I support this legislation as it will continue to assist Bahamians with chronic diseases to get the medicines they need to stay alive. These medicines are essential in helping combat the crisis of non-communicable diseases affecting so many in our country. But medicine alone, Madam Speaker, will not do the job. And that's why, just as we are debating a compendium of bills, we should have a compendium of health components. Medication, one, the Healthy People program, two, and the National School Feeding Program, inclusive of the after-school program. I think all of them together would help with the chronic non-communicable disease, save many lives, decrease the demand on our hospitals, etc. Legislation such as this easily achieves bipartisan support as it is intended to help our people. Parliament, Madam Speaker, will need to keep a keen eye on this issue. The crisis of non-communicable diseases is ongoing. As more Bahamians are afflicted by these conditions, it will be necessary for Parliament in time to increase funding for prescription drugs to keep up with the crisis. And I think there was a bill that was tabled in this Parliament, I think in 2010, 2009, with respect to the prescription drug plan. And it was never passed, but it's something we have to look at because funding will become an essential component for the national health to succeed and survive, as well as the national prescription drug plan to succeed and survive. We can talk as much as we want, but unless there's proper funding, the program, as good as it may be, will collapse. And it has to be bipartisan. It has to be agreed upon because health, education, and safety, security, should not be a political matter. Madam Speaker, as we are discussing health, I must raise a health-related question to the government. You know, I couldn't just ease all through. Earlier this month, no. I said, let me repeat. Health should not be political. Yes. But we can discuss, we can look, and make determination as to what is best for the nation. All right? Earlier this month, the government finalized a deal with China for the specialty hospital here in New Providence. Many hoped that the government would reverse course with this project and build a new wing at Princess Margaret Hospital, which was formerly the consensus of PLP and FNM administrations. It seems, Madam Speaker, however, that this administration wants to go in another direction, and they have their reason. The proposed hospital is expected to cost $267 million. The government is borrowing $195 million from China of that total. The remaining 27% of the project cost, or $72 million plus, will be funded locally or internationally, or both, by the Ministry of Finance. The government has yet to reveal the details of this borrowing and how much this will cost taxpayers. The funding mix for this project is quite odd and begs many questions. Construction and completion of the hospital is expected to take between 31 and 36 months, and the hospital will be finished during the term of the next government. I have raised concerns about this project before in this place. Many other medical professionals are alarmed at this project for many reasons, ranging from staffing, environmental concerns, traffic flows, logistics, and other problems. One of my major concerns is the large number of Chinese workers that come with Chinese loans. With Chinese projects, China gets the general contractor and the labor. At the contract signing, the Minister of Health did not say how many Chinese workers are coming to the Bahamas as a result of this deal, even as many Bahamians still need jobs. According to the media, he said, according to the media, I have it here, we are presently at 50-50, 50% Chinese, 50% Bahamian workers. I'm quoting. And we're trying to see if we can do a bit better. But I would keep the media and the country informed on the final document of where the labor component would lie, end quote. The Chinese are very detailed. I want you to listen very carefully to this part. The Chinese are very detailed and they are very thorough in their analysis of the projects they enter into. They analyze. By now, they would know how many Chinese workers they will use on this project. Why is it that at this late stage, when deals are being signed, the Bahamian people cannot be informed of how many Chinese workers are part of the PLP's hospital project? Is it 500? I don't know. Is it 1,000? I don't know. Is it 1,500? I don't know. Maybe more, maybe less, I don't know. But contracts are usually not signed unless these things are worked out. It is unfortunate that so many foreign workers will come into the country for a public works project. Whoa, we're running out of time. We as a country have a youth unemployment rate that hovers around 20%. Our young people need jobs. Bahamian public work projects are supposed to create work for Bahamians and not others. Based on how the Chinese operate, many wonder whether the government will have to hire Bahamian workers for this project out of the second set of money they will borrow, at possibly a much higher interest rate. I don't know. The Chinese loan component likely will fund Chinese contractor and the Chinese workers. Another concern many have with this project is regards who will operate the hospital. This is very important. Who will operate the hospital? And I want all Bahamas to listen carefully to this component. This is a concern that doctors and nurses have publicly shared. We have a well-documented shortage of nurses, but that's worldwide. The US is short by about 250,000 nurses. That's worldwide. We also have shortages in other medical specialists and physician specialists required to operate medical facilities. The government has not released any detailed plans anyone is aware of, declaring how we will find the necessary staff to run this hospital. Many are worried that this project will become a white elephant and will cause more problems for the healthcare systems. Many are concerned that it will draw resources away from PMH, the RAND, and clinics across the country. Another concern is that when the hospital is finished, it will sit for quite a while, not being fully utilized because we do not have all the people required to operate it. Madam Speaker, I stress that point because, and I repeat again, the clinic in Abaco, the mini hospital, was constructed at the time I was Minister of Health. The clinic in Exuma, the mini hospital, was constructed at the time I was Minister of Health. Beautiful edifice. Those clinics are not properly utilized up to the day. You may say it's an elephant. They're not utilized properly up to today. We do not have the staff for those facilities. Dental facilities in that clinic, the Abaco clinic, the Exuma clinic, were up until recently, from 2009 now, were up until recently, new dental facility, still in the plastic. Still in the plastic.
Trying to figure what that was.
If we're experiencing the problem and we're building a big hospital facility, we will have the same challenges. All I say is let's work together and resolve the problem. It is not your problem, Minister. It is a worldwide problem, shortage of healthcare workers. It's a worldwide problem. Let us all sit together and try to resolve the issue. Hospitals are very difficult to operate. Where will the people be found to run the hospitals? I guess you'll bring people like me out of retirement to come and run the hospital. But you know why I didn't go back into medicine? I just can deviate for 1 minute. Why I didn't go back to medicine? And we have to, no, these are facts. These are facts. We as a country are too polarized. That has to change. If I was frightened that if I went back into medicine practice, somebody can come in there because a former prime minister and a politician, somebody can come in there and accuse me of certain things so they can take headline and have in the paper that they're going to sue me and this and that. Your reputation does not worth the money that you would get. And I decided, no, my reputation is worth more to me than running that risk. But Minister, that was just a sidetrack. That was just a sidetrack. That's a sidetrack. That's just a sidetrack.
That's a sidetrack. The real reason is here. That's a good point.
Madam Speaker, at the contract signing, the Prime Minister said the Bayman people deserve a health care system that works, one that meets them where they are, and one that lifts the standard of care for everyone. And I agree. But that will only happen via this hospital if the staffing issues are worked out. Otherwise, we will have a large building that does not have the workers to run it, to make it run. This government already owes millions to healthcare workers for medicine, dialysis services, and other bills. And that's not just a problem with you, it's a problem with governments. The PLP has failed to fix major problems at PMH and throughout the healthcare system. Having already massively failed to improve healthcare for many fronts, they may be making the problem much worse. This will make the problem worse. Madam Speaker, I would stop here, but I want to say before I sit, I want to remind the public again to attend our Gambia event, participate in our Junkanoo activities, and I want to remind the member for Central and South Eleuthera, we still have challenges in Kalani. We still would like our streets, especially South Ocean, to be repaired. I mean, you can refer to our road as patches, and the cars just float, just dropping in holes all over the place, and that's challenges. We want to look like Angliston one day with I-95s that are going through. I mean, I drove there, went to visit some family members. I had to look around to see if I was in Florida. It's I-95 highway. And we're having challenges, we're still having challenges in the West with voltage, low voltage fluctuation. And the low voltage will, with time, affect people's refrigerators, stoves, etc. Yeah, but I'm speaking to the government. So it's a problem. The low voltage challenge is still, generators are still popping in because generators will interpret it as electricity is off, so they're coming on. And the low voltage is a challenge there. And of course, I want to remind BPL that they had broken down the wall in South Ocean, the entrance, welcome to South Ocean, so that they could have had access to their transformer. They repaired their transformer, but the wall that they've broken down, they've left it. You must learn, if we want to become first world country, let's behave like first world country. You met my wall there, you break down my wall, repair the wall. But Madam Speaker, Kalani supports these compendium of bills. Thank you, Madam Speaker.
Thank you, Honourable Member. Asmini,
Madam Speaker,
the Chair recognizes the Honourable.
thank you so much, and thank you for allowing me to say a few words after Kalani. I didn't want to stop him in his presentation. He made some quotes at the signing of the first agreement with the Chinese government, and I made it clear that there's a second agreement with the EXIM Bank that needs to be signed. We are in negotiation for the labor component, and I made it with the labor component associated with the deal, and I made it very clear that I would come to this Parliament and I would speak specifically to this Parliament with all of the details associated with this particular loan. Right, no, but I just want to make it clear because you have come with constructive criticism as you see it, and I respect that. We see it differently, and our trajectory and our plans are directly related to our healthcare planners guiding us on what needs to be done. And I assure you that this administration have no intentions of constructing a hospital and creating a white elephant. In life, yes, well, that's fine. I wanted to go on record that as minister, my intention and the intention of this administration is to improve healthcare delivery systems, improve tertiary healthcare services, and to be able to provide better quality services for the Bahamian people.
Yes.
And this particular hospital is part of our plan. And I didn't wake up one morning to build it. We've been guided by experts on what we need to do, and we are following our blueprint to ensure that it's happened. Once again, the Bahamian people can rest assured that on conclusion of these loan facilities, I will come to this Parliament with a communication to fully outline in a transparent way the entire steps and end product of the loan with the Chinese government. I thank you.
Thank you, Honourable Member. The Chair recognizes the Honourable Member for Kalani.
Thank you very much, Member. Member, I would say when we were designing the block next to the critical care, about 4-story, that was done by expert. And you would say you have no design. It was a design build. The contract was signed, and I can, yes, by all means. You want me to play it so the world could hear it? No, I will. It's here. It's here. It's here. You know, I don't come here without my ammunition. I don't come with BB gun. I come with scuds. But so yes, so we had experts, and the experts had advised us that the present location was the best. And at that time, we signed the contract. You'll see the pictures and everything of the Minister of Health signing the contract at the office of the Prime Minister. And when you come and report, kindly inform us when the staff will arrive, where you're going to get these staff, all the extra doctors, all the extra nurses, the techs, et cetera, et cetera. Because I know that America has a shortage of 250,000 nursing personnel. It's a worldwide shortage. So just, you're going to give us a breakdown of all of these aspects of the health sector. And I'm going to forward this to you so the minister can see that the contract was signed. It was signed in 2021. All details will be there for him. And, of course, for the speaker.
Thank you, Honourable Member. As many, the Chair recognizes the Honourable Member for Nassau Village.
Greetings, Madam Speaker. I always stand in this House humbled by the opportunity given to me by the great constituency and constituents of Nassau Village. And Madam Speaker, before I delve into the compendium of bills, I wish to extend condolences to the family of Mr. Reginald Horace Taylor, who will be funeralized this Friday. I was actually scheduled to go down to Regatta in Kidd Island, where my family is from, but I do intend on attending that funeral because it is out of an abundance of respect to him and his family. Madam Speaker, to my constituents, we have also continued our small leak repairs program. Now, it isn't to be confused with Urban Renewal's small home repairs, but it's our small leak repairs program that is built out of the constituency allowance to afford my constituents some immediate help. So we have been doing this for the last 4 years, and we will continue to do so. Madam Speaker, I took a keen interest in the compendium of bills because my constituency is predominantly composed of urban areas, right? You would have heard the member for Kalani and also the member, Good Doctor, from Tall Pines, refer to non-communicable diseases, NCDs, and their prevalence. Now, what I found interesting was that there's a disproportionately large amount of NCDs in urban areas. So I would have expected for all of the urban areas to speak on this groundbreaking legislation put forward. Madam Speaker, NCDs are brought on by poor diets, and I've said in this House before that I do believe that we have just a bit too much cheap food in certain areas, high in calories, greasy, and too much sugar. There was once a conversation surrounding even implementing a tax on sugar to try and bring healthier diets for Bahamians. And on behalf of my constituency and just, I would say, a woke Bahamian, I would welcome these types of legislations as we move forward with this new Bahama line. Madam Speaker, my heart goes out to my dear constituent, Ms. Cheryl Sanders, who would have been recently diagnosed with breast cancer and who we would have supported to undergo her first treatment this weekend as well. When we speak about health in the nation, we think about our loved ones impacted by non-communicable diseases, your diabetes, your cancers, and we think that it's just a natural occurrence, but it's primarily due to poor diets. Madam Speaker, as I stand before this esteemed House today, not merely to advocate for legislation, but to rally behind a vision of a Bahamas where health is a human right, where no citizen is forced to choose between their life and their livelihood. The good member from Golden Gate alluded to it earlier in her speech as well. There are too many Bahamians having too many grill-outs to pay for health care, to ensure that their loved one stays with them here. Madam Speaker, the data is plain and the evidence is clear. Madam Speaker, I believe in the Bahamas where equity, dignity, and wellness are guarantees and should be guaranteed for every Bahamian, irrespective of their socioeconomic status, where they live, how much they make. Madam Speaker, I chose to focus on the National Health Insurance Specified Chronic Diseases Prescription Drug Fund Bill, 2025, because it really hits and then it embodies that aspiration. It is a testament to our collective commitment to build a society grounded in compassion, fairness, and opportunity. Madam Speaker, my constituents regularly come into the constituency office and they tell me about various prescriptions that they have to take and how much it costs and how much of a burden it is on the family just to ensure that they receive some comfort, Madam Speaker. So to see these compendium of bills address that in particular was lightening to my heart, and it was lightening and is lightening to my entire constituency. But Madam Speaker, to fully appreciate the significance of this compendium, we must look beyond our shores and into the global arena, where the health sector is still of paramount importance globally. Madam Speaker, since the mid-20th centuries, nations have prioritized universal health coverage. They have reaped the benefits of it: improved populations, improved economic resilience, and social cohesion. Madam Speaker, the member of Tall Pines stated that the World Health Organization has consistently championed and advocated that access to health and quality health services without financial hardships is a human right and vital for sustainable development, sustainable for national development, to ensure that the workforce is present, to ensure that it isn't too much of a burden on social safety nets. Madam Speaker, when we look at smaller countries, South Korea, whose late healthcare reform and healthcare insurance reform assisted in controlling costs, investing in health infrastructure, it transformed the health landscape in their country. Today, South Korea boasts of some of the world's highest life expectancies and lowest maternal mortality rates among comparable economies, Madam Speaker. Similarly, we know that Bahamians tend to love to go to the United States and to Canada for health care. Canada's universal health care system, which would have been established over some 50 years ago, stands as a beacon, Madam Speaker, of how government-led systems can ensure fairness, reduce disparities, and save lives. Madam Speaker, these successes demonstrates that universal access to quality health care ensures long life, and it also ensures and reduces long-term costs. You see, Madam Speaker, there's an age-old adage that prevention is better than cure, but I believe that prevention is cheaper than the cure, Madam Speaker. Closer to home, when we analyze the Alma Ata Declaration of 1978, endorsed by the World Health Organization and UNESCO, Madam Speaker, we see that health is a fundamental human right and called for by countries of the world as a global effort towards primary health care being accessible for all. Madam Speaker, it is underscored publicly that it should be publicly funded, that equitable healthcare systems are crucial building blocks of social stability. So, Madam Speaker, we see that the Bahamas is once again, under this Progressive Liberal Party government, modernizing and moving with the times. Finally, Madam Speaker, we see that we're actually keeping up and are aspiring to keep up with the world. Madam Speaker, we have looked at our healthcare application globally. But Madam Speaker, here in the Bahamas, our history echoes lessons. They echo lessons of generations of disproportionately large amounts of breast cancer, prostate cancer, high rates of diabetes, hypertension. Madam Speaker, despite our natural beauty and economic aspirations, grave health disparities persist. Chronic illnesses such as diabetes, hypertension, and cardiovascular diseases are leading contributors to morbidity and mortality. Recent data indicate that they account for over 70% of hospital admissions. Madam Speaker, non-communicable diseases account for 70% of hospital admissions, placing a punitive financial burden on families and public health systems alike. Madam Speaker, Nassau Village is my home. It's a densely populated area of hardworking people with socioeconomic vulnerabilities. You see, communities like this vividly exemplifies certain challenges. Many residents face almost insurmountable barriers, costly medications, limited access to consistent health care, and inadequate health literacy. And my constituents ask me, Mali or MP, what's the solution? How do we get to the other side? Madam Speaker, the solution lies in adopting a comprehensive, responsive approach, one rooted in international best practices and tailored to our unique context. Madam Speaker, the prescription drug fund proposed in the bill, if you analyze it, aligns mostly with Germany's statutory health insurance. It provides affordable medicines through centralized funding. When we look across the sea, it aligns also with Thailand's universal coverage scheme, which dramatically reduces disparities and increases longevity. But Madam Speaker, when we look at the core principles of the bill, we see equity and access, because no Bahamian should be denied life-saving medications because of their economic or geographic status. We see the nation's sustainable development goals being adhered to, international standards. Madam Speaker, another core principle, prevention over cure, because early treatment and medication adherence are proven to provide and prevent hospitalizations and reduce overall spending and overall cost. Madam Speaker, we also see sustainable financing, because the inclusion of actuarial reviews and oversight mechanisms inspired by the World Bank and the IMF, they guide long-term viability and ensure public trust. Madam Speaker, the impacts on my constituents and my constituency as we go forward with this are profound. Our seniors, many living with fixed incomes, will no longer have to forego medication, Madam Speaker, essential to their life and essential to their health. Families often stretched thin financially will be empowered to invest in education, invest in housing, rather than continuously spending on medical bills. Madam Speaker, when I look at my constituents, the unemployed, the underemployed, individuals that represent the backbone of our community's resilience, they will be able to finally access treatments without risking their own economic stability. Madam Speaker, we cross-reference and analyze the bill going forward, and we see issues, or we see similarities rather, to Thailand's Universal Coverage Scheme of 2001, but also Rwanda's community-based health insurance, a model that has shown even with limited resources, Madam Speaker, effective healthcare systems can be built through community ownership, government commitment, and innovative financing, ultimately saving countless lives, Madam Speaker, and empowering citizens. Madam Speaker, these examples reaffirm a universal truth. Investing in health is investing in human capital, investing in economic resilience, and investing in social stability. No nation, Madam Speaker, regardless of its income level, can afford to overlook the health needs of its people, especially the most vulnerable. Madam Speaker, in Nassau Village and across the entire Bahamas, our specific challenges demand tailored solutions. Overcrowding, limited healthcare access, high prevalence of lifestyle diseases threaten our community's vitality. This legislation, Madam Speaker, offers an urgent, responsible pathway, combining international best practices with international and local ingenuity. Madam Speaker, the bill alleviates the financial burdens on families. It reduces preventable hospitalization. It improves health literacy through targeted programs. It fosters community partnership with local pharmacies and clinics. And most importantly, Madam Speaker, it restores hope in the capacity of our nation to care for its own, no longer having to fly away to other countries, but a mechanism formulated and created to ensure that Bahamians receive the necessary health care domestically. As we have seen throughout history, Madam Speaker, and across nations, well-funded, equitable healthcare systems do more than extend lives. They build social cohesion, foster economic productivity, and uphold our national dignity. Madam Speaker, I won't belabor the point, but I urge each and every member of this House to reflect on our duty as members of Parliament, to prioritize the health and well-being of our people as inseparable parts of our national identity. Madam Speaker, the second bill that I took a keen interest in was the Pharmacy Amendment Bill. Madam Speaker, this particular bill has significant potential to modernize our healthcare system and improve the lives of many Bahamians, particularly my constituents. Madam Speaker, this bill at its core seeks to amend the Pharmacy Act by recognizing and legitimizing electronic prescriptions. This may seem like a small step to some, but it carries the potential, Madam Speaker, to unlock greater efficiency, accessibility, and safety in the way medications are prescribed and dispensed. Madam Speaker, a significant portion of my constituents face difficulties related to access to health care. Many are citizens, senior citizens, individuals with mobility issues, or working class families struggling to battle multiple responsibilities. Madam Speaker, for these individuals, the current process of obtaining a prescription and having to go to refill it can be arduous and time-consuming. Madam Speaker, oftentimes prescriptions require constituents to physically present themselves to a doctor solely to renew a prescription, placing undue burden on their already stretched resources. But Madam Speaker, this particular bill addresses that. Madam Speaker, imagine a senior citizen struggling with arthritis who can now receive their prescription renewal without having to endure long journeys to the doctor's office. That, honorable members, is the increased convenience of this particular bill and what it delivers. Madam Speaker, imagine a single mother juggling work and family who can now pick up a child's medication with a quick stop at a pharmacy after school, thanks to the seamless transfer of an electronic prescription. That, Madam Speaker, is improved access. Access that can make all the difference in the health and well-being of a family. Madam Speaker, we know all too well the stories of handwritten prescriptions. The member for Central Grand Bahama alluded to it. And the possible, negativities or negative outputs that could come from an incorrect reading of that prescription. Madam Speaker, with electronic prescriptions, we can eliminate those risks, ensuring that patients receive the right medication in the right dosage every single time. That, Madam Speaker, is enhanced patient safety. Madam Speaker, if we look throughout the Caribbean, we see that it's not only the Bahamas moving towards electronic prescriptions. For example, Barbados has been piloting an e-prescribing system to streamline medication management and improve patient safety. Jamaica has also been exploring digital health solutions to enhance access to health care in their rural communities. That seems like something that would definitely be of benefit for our far-flung constituencies and those remote communities. Madam Speaker, we can learn from their experiences, and this bill encompasses that. Both the successes and challenges as we move forward with implementing e-prescribing in the Bahamas. These other nations provide a proof, Madam Speaker, of the concept, and it shows how it can truly improve outcomes for their citizens, which the same positive outcomes will be provided by us implementing and approving this legislation. Madam Speaker, I urge all honorable members, through you of course, to support these compendiums of bills. They are practical, they are common sense measured, and will improve access to medications, enhance patient safety, and modernize our healthcare system. These bills, Madam Speaker, will directly benefit not only the people of Nassau Village, but the Bahamas at large, making their lives a little easier and a little healthier. Madam Speaker, the 2020-25 healthcare bills are more than just legislation. They stand as an example of a moral imperative. Madam Speaker, let us support these initiatives wholeheartedly. Let us pave the way for a future where no Bahamian is left behind, where health is accessible, where affordable health care is, of course, affordable, and a source of pride for each and every Bahamian. Madam Speaker, together we can forge a stronger, healthier Bahamas, one that embodies the ideals of fairness, compassion, and hope. So in conclusion, Madam Speaker, on behalf of the good people of Nassau Village constituency who have welcomed legislation like this, I support the compendium of bills.
Thank you, Honorable Member Asmini. Oh, before the chair recognizes the Honorable Member for Kalani.
Madam Speaker, the minister said he had great difficulty over the past couple of years finding the document. So I want to table for him. This was a contract signing by my government in July 2021 for $90 million for the new hospital, with the Beck Group for the new hospital at Princess Margaret Hospital and the Rand Memorial Hospital. We would have been, as I speak today, off a nice air-conditioned new hospital. Both. So I have the document here for you.
How did the document be brought out? Order and document to lie on the table. Asmini, the chair recognizes the Honorable Member for Long
Contract
Island.
signed. We still have money.
Madam Speaker,
We use some of it for small business development.
Madam Speaker, I rise on behalf
I can get the exact amount.
of the great people of Long Island, my beloved hometown. Madam Speaker, firstly, before I get into this bill,
Bottom line is,
I want to pay tribute to
bottom line is work together to improve the health.
I want to honor the life and legacy of a man who I greatly respect, Mr. Harvey Tynes, KC, a man whose name carried weight, not just in the courts, but across the country. Madam Speaker, Mr. Tynes was known for his fearlessness and his unwavering dedication to fairness and justice. He was a fighter for the rights of others, and he hated injustice. Frankly, he leaves behind a distinguished legal record. He leaves a legacy of courage, conviction, and integrity that would outlast his life. His impact on Bahamian law and on countless lives is indelible, and his absence will be deeply felt in courtrooms, offices, and homes. Mr. Tynes was a colorful figure, not just in his words, but in his presence. He had a sharp wit, a distinctive way of expressing himself, and a personality that couldn't be ignored. He was blunt, honest, and unafraid to speak the truth, even if it was uncomfortable. Whether in court or in casual conversation, he brought energy, edge, and often a touch of humor to the moment. His stories and opinions and the certain flair he had made him unforgettable. I had the privilege, Madam Speaker, of being represented by his law firm, and I can say without hesitation that when Harvey Tynes stood with you, he stood all the way. He gave us the straight truth, no fluff. I remember calling him one weekend, and his wife answered, and within minutes, he himself was on the line. He started what was supposed to be a quick check-in call that became a long, human-to-human conversation about anything and everything, and that was him. Brilliant legal mind, but also a man who valued people, connection, and loyalty. I cannot speak of him without mentioning his family, so I extend condolences to his wife, his children, grandchildren, his family, to my brother Iram, his son-in-law. And of course, you know, he was good friends with Damian Gomez. I saw when he died, Gomez, it was like a blow to him. So I know I saw how he took that. So to Mr. Harvey Tynes, may your soul rest in peace. Madam Speaker, I rise today to speak on a compendium of 5 healthcare bills before this Honorable House, an ambitious package that seeks to reshape our national health insurance architecture. It seeks to integrate a drug provision and address chronic diseases and wellness policies. We endorse the noble goal of universal health care. I believe that these bills seek to move the system from one that is fragmented and reactive care toward one that is more structured, and equitable, preventative, and accessible to all Bahamians. I am hopeful, Madam Speaker, that these bills seek to reduce future burdens on hospitals and on families. I see the attempt to close the gap between the rich and the poor, especially when you look at the national health insurance aspect, to close the gap between Nassau and the Family Islands, and to provide private insurance and a public provision. I believe that these bills create a framework where private providers, insurers, and government can work together under clear rules. I appreciate the move towards digital health records, e-prescribing. We know the story about prescriptions, handwritten prescriptions. I see the move towards data-driven planning, which is always the way to go in the 21st century, in the age of AI and so on. And of course, regulatory upgrades to meet international norms. And I see, and I can say, Madam Speaker, if these bills are executed with the infrastructure, I think that Bahamians can finally get the kind of health care that we're entitled to, and nothing is perfect, you know, and I'm going to make some recommendations as well. I didn't come here just to endorse and move on. But I appreciate the move towards equity in healthcare access. That is a plus. I appreciate the expansion of drug access for chronic conditions. I have a grandmother who suffers from hypertension. All of us have family members. Some of us may suffer ourselves. We have family members who suffer from hypertension and diabetes, or know someone, and various other chronic conditions. Madam Speaker, and I know the value of having, or not, I know the issues with not having insurance and the value of having the ability to have access to drugs. When I was small, I had asthma, you know, a horrible condition, and there are many who have it. I outgrew it, but there are others who never outgrow it, you know, and then those who have cardiovascular issues. I see the move to strengthen pharmacies on family islands. You know, the pharmacy network in our remote communities is simply not there, okay? And if the local clinic don't have it, you gotta wait to send to Nassau for it. And so we want to prioritize prevention over cure. And I think even when you look at the health and wellness aspect of this, you know, if you could address issues that are the root cause of certain diseases, right? Particularly those non-communicable diseases, that moves us into a more healthy society, and one where we prevent rather than worry about cure. Madam Speaker, I also note that one of the bills, particularly that's the Health Promotion and Wellness Bill, seeks to empower authorities to regulate harmful imports, you know, with excessive sugar and salt and trans fats. I welcome that. I believe that we ought to start making healthier choices easier for Bahamians, and that should also include, though, reducing taxes on the healthier choices at the border, customs duties. So when they come in, Bahamians can go into the store and afford the organic products on the shelves. Madam Speaker, there are some key observations I've also made. For example, with the NHI redesign, there's no, I'd like to see the standard health benefit schedule published, you know. See any actuarial modeling. I'd like to see that. And it's unknown how it would impact private insurance plans or existing coverage. And I have lots to say about the private insurance sector. I come into that, okay, because that has been, man, lots of Bahamians have had to give up their insurance due to these high premiums, these unpredictable premiums, etc. Madam Speaker, I also note, as it relates to the NHI redesign, there are no wait time guarantees or quality reporting in law, you know. And we want to know also what is the 3 to 5 year cost plan. That plan is missing. We'd like to see that, like to know that side of things in terms of funding. As it relates to the drug fund integration, you know, I think there's some 41,000 patients currently on the program, right? So we'd like to know what would be the transition plan for these 41,000 current beneficiaries as they migrate from one plan to the next. We want to know, I know also that there's no pharmacy network guarantee for the family islands under this plan. So we'd like more information on that. And then, of course, no clear data provisions as it relates to prescription tracking. Is that going to be in the regulations? You know, is that going to be somewhere in the regulations with respect to these data provisions of prescription tracking? Relative to the Health Promotion and Wellness Bill, Madam Speaker, I think that any levy on food or imports should require impact assessments and consultation. You know, there's some mom and pop stores that rely on certain imports, and so we gotta balance our health with also not driving some of these smaller businesses out of business. Give them time to adjust to avoid burdening some of them. I think those considerations should be had with respect to that. With respect to the pharmacy and dental bills, the amendments there too, I know there is no appeal rights or clear timelines for licensing, something that the government could consider. I would propose, Madam Speaker, the government mandates a 3-year independent review of both NHI and the drug fund and table the reports in Parliament before expanding entitlements. I think that there should be Family Island minimum access guarantees with telehealth and mobile clinics funded by the public. And I think we should tie the standard health benefit and the drug fund to minimize access or to minimum standards. We should tie them to minimum standards by each island or by the islands, including telehealth solutions. Madam Speaker, the condition of healthcare services on our family islands, islands like my beloved Long Island, where Bahamians deserve the same dignity, quality, and access, there is much to be desired. I am hopeful that these bills will progress the state of affairs on our islands. You know, we're debating 5 health bills here today, but I could not in good conscience stand here and confine my comments to theory and policy when the reality on the ground is also starkly different. For Bahamians, there's a serious concern, Madam Speaker, nationwide, as it relates to some of the conditions in health. We cannot deny that. Serious concern. In the family islands, for example, and I'll use Long Island, we have a concern with respect to emergency airlift. You know, I've gotten a lot of complaints about emergency airlift being delayed regularly, and families having to wait for extended periods of time for a plane to arrive. And patients, you know, given the archipelagic nature of our country, sometimes you have patients deteriorating mid-flight, particularly after waiting for a long time, or even deteriorating before leaving the island due to these wait times. And then you have issues where folks come into Nassau and many have to wait for hours before treatment due to overcrowding or lack of readiness. Madam Speaker, I believe that family islanders, we deserve to be able to have advanced coordination with PMH where they are ready to receive patients from these islands, ensuring that there's beds and specialists available before the flights even depart. You know, we have people like Marty Fox and Joel Butch Freeze and Freddie Adderley in Long Island. These are all pilots who operate aircraft stationed in Long Island. And there was a time when they used to be able to bring patients out of the island into Nassau during emergencies. I've been hearing that I don't know if they can still do that today for some reason. And I know we are one of the islands that have tall pines. Is that still? Okay. Right. I know a lot of them have been told, so they've said, that many of them cannot do it as they used to because there was a time when persons got ill, they fly them straight into Nassau. Now a lot of folks are having to wait for lengthy times. We happen to be one of those islands that have the good fortune of having pilots living there and pilots who actually have aircraft that can come out. And usually what would happen is when Marty or Butchie or Freddie or one of those come out with a patient, the nurse comes on that flight to ensure that that person gets out as speedily as possible. Madam Speaker, you know, I understand some of the challenges that face PMH. I see the infrastructural challenges. And as we pass these bills, you know, the only thing to complement these bills would be to have the infrastructure and the personnel in place. But PMH, Madam Speaker, is a crisis there. It's shameful. You have chronic bed shortages, leading to patients being treated on gurneys in the hallways, sometimes for days. Okay, I can tell you, my constituents complain to me all the time. You have an overcrowded A&E, long waiting times, patients sleeping on chairs, on the floor, unsanitary conditions being reported, you know, leaks, broken toilets, lack of proper sanitation. You talk about, you even hear the stories about shortage of supplies, gloves and medication and linens. Okay, the healthcare personnel who speak to these issues, the staff who complain about being overworked and burnt out, many leaving the public system for the private sector, or many just leaving and going abroad. I mean, I see there are entities out of Florida, for example, that boldly recruit in the Bahamas. You see some of the big signs. There was a sign right at the corner at PMH, maybe about a year or two ago, and the entity was recruiting nurses from the Bahamas, somewhere up in Central Florida. Madam Speaker, the infrastructure at PMH is very much outdated. And the upgrades are very much needed. I know we've seen piecemeal upgrades over the years, right? But man, I am one of those persons who firmly believe that we need a brand new hospital that covers every aspect of treatment, every aspect. Madam Speaker, I think Bahamians deserve better. They deserve to know that when they walk through the hospital, especially poor Bahamians who can't afford insurance, who don't have insurance, that when they walk through the hospital, they will receive timely, dignified care, not be left waiting in a hallway like an afterthought. And this is the reality many Bahamians face, especially when you go in there either for your own treatment or seeing your family in there. And this is a matter of national disgrace that must be fixed. Madam Speaker, our system also lacks, I believe, adequate mental health doctors and counselors. There are too many Bahamians, Madam Speaker, young and old, who are struggling with depression and anxiety and trauma and untreated mental illness. And many are losing their lives in silence. We have only one psychiatric hospital in the country, that's Sandlands, and very few, like I said, very few mental health doctors and counselors in the public system. You know, you have child and adolescent mental health services that are extremely limited. And we hear the stories of rising youth depression and suicide attempts and drug abuse being untreated. I think there was a recent report, I don't know if it was Tall Pint or someone, there was a recent report about the increase in suicides in the Bahamas, and then among children attempting suicide. Family islands like mine often have no mental health support, Madam Speaker, leaving the police and untrained staff to deal with such crises. And we all know the stigma that comes with mental health concerns and mental health issues. The stigma and the lack of access means that Bahamians suffer in silence or face arrest rather than care. There are many persons, you see them walking around, they get arrested, okay? And it's just someone just had a mental break. Rather than being thrown into the slammer, they should get mental health, adequate care. So I call for the recruitment of more psychiatrists and psychologists and counselors to the public sector, for mobile mental health units to reach family islands, even if they got to move from one island to the next. And I'm sure that the member for Tall Pines can appreciate how these islands are. I call for greater school-based counseling programs that deal with mental health nationwide. And of course, community crisis helplines and mental health awareness campaigns. Madam Speaker, with reference to telemedicine, I think telemedicine is a bit of a missed opportunity. Governments, FNM and PLP, have announced telemedicine years ago, yet many islands lack functional systems. Many clinics lack proper, decent, steady internet connectivity or basic equipment for virtual consults. So you have a lot of family island residents having to fly to Nassau for minor follow-ups or consultations that could be done online. The solutions do exist. We could secure video platforms, proper internet. You know, you got Starlink now. Maybe that is something we should look into. Diagnostic kits, remote specialist access, so that we could bridge this gap between Nassau and the family islands. Because I can tell you, there are many persons who have to come to Nassau for things they ought not to have to come to Nassau for, even now. So why is telemedicine still not operational nationwide, despite millions spent on IT, and despite the hype across multiple governments about the impact of what telemedicine would do or be to bridge the gap between our main island and our family islands? Madam Speaker, I think it is unfair for family islands to have, or family islanders, to have to charter flights or wait weeks for consultations to be handled in person when it could be done remotely. Madam Speaker, you know, I cannot get up in this place and not address some of the health concerns of my constituency. You know, sometimes I feel like a broken record speaking on some of these issues repeatedly. The morgue in Long Island is still an overdue concern, Tall Pines. It's been in the yard for over a year. Families continue to be forced to transport deceased loved ones some 30+ miles north. And the emotional trauma of that, disrespect to grieving families, putting their loved one in the back of a truck and having to transport them north, cannot go unaddressed. We must address that. This is undignified, I believe it's inhumane, and I believe it is completely avoidable. I've raised this issue repeatedly in this House and through the proper channels, and sometimes, many times, feels that my concerns fall on deaf ears. Speaker, I call upon the member for Tall Pines and the Ministry of Health and the Department of Public Health to ensure that that morgue is installed and made operational at the Deadman's-Key Clinic. With respect to the Roses Clinic, we repaired that from our constituency funds, but we need a nurse to man the clinic. That clinic is located in the deep south of the island, but it remains unused. And we're hoping that it's not a political reason for it being unused, but the community suffers if it is not utilized, having already had the repairs done. We have 2 clinics in Long Island, and both the Sims Clinic, 2 of the main clinics, Sims and Deadman's-Key, could use repairs. We have a shortage of doctors. I constantly and persistently address the issue of getting 2 doctors for Long Island, because one doctor, the roving doctor that comes in, they come in for 2 weeks and another one comes in, or sometimes there's a gap of 2 weeks between the next one coming in. Can't handle the entire island. It's a very long island. It's called Long Island for a reason. So we need to have 2 doctors on the island. We must go back to having 2 doctors on the island. And some of the excuses I've heard about, doctors, they're not being residences to house doctors and accommodate them. That's not a real excuse. Let's repurpose some of these old buildings, these abandoned buildings, and make them housing for doctors. Speaker, the head nurse on the island has to drive her own car to deliver medications, make home visits, attend emergencies, etc. And you know, traditionally that nurse has always had a vehicle, and I would call upon the minister to assist with getting a vehicle to that nurse, which would have to alleviate, although it could be a small vehicle, but the head nurse on the island usually always have a vehicle to move about and take care of the health concerns of the people of Long Island. Madam Speaker, I also intend to be, in the not too distant future, I also intend to donate wheelchairs to a number of entities, clinics as well, on the island, and I hope that you would find that acceptable to All Pines and to a number of other places, public spaces and persons down there. I'll have further announcement about that in short course. Madam Speaker, I was speaking to Leah Baker just a short while ago, second homeowner. She came in maybe about a couple of weeks ago. She told me that she's been writing to P.S. Colin Higgs, that when she came in through LPIA, they confiscated bags of medical items that she was bringing in for the clinic, the Deadman's-Key Clinic in Long Island. And she said among the items were masks, and you know, I was called on to speak as she was texting, so let me see if she said anything else. But diabetic, glucometers, various medications, and so on. So she said that she was advised that the bags are now at the Ministry of Health. So if they are indeed at the Ministry of Health, I would invite the Minister of Health to look into that with a view to seeing that these donations get to the destination that they were originally intended for, which is the Dedmanski Clinic in Long Island. Madam Speaker, private health insurance in this country is pricing Bahamians out of care. That's the current state of affairs. Premiums climb every single year, unchecked. But when illness strikes, Madam Speaker, these concerns, when illness strikes, these same entities, they suddenly start delaying, they start denying, they start making excuses, and they start ducking their responsibilities. So you pay your insurance for 20 years, you get sick, and now all of a sudden, there's all kind of talk. Deductible and oh, we don't cover that, or oh, you're now too old, or whatever the story is, there's always a story. And Bahamians are complaining about that, on top of the fact that they're being priced out of being able to afford it. I know for sure this year, I received a call after having general insurance on a space for years. They called me and say, hey man, we don't provide hurricane insurance anymore for buildings in the Family Islands, commercial spaces. But we could still give you insurance for fire, and it'd be the same thing. I said, no. You all got to let that expire. But this is what is happening in this country. We have to properly regulate the insurance industry. And there has to be some kind of cap on premiums. I was coming on a flight from Long Island to Nassau just last week. And I spoke to one of my constituents who told me that her husband had to drop his policy when his premium said $800 a month. And when he needed it, Madam Speaker, she said the insurer played games and didn't provide the coverage. She herself said she pays nearly $900 a month for her insurance. But she said she has a congenital heart condition that she was born with that is not covered. So there's so many parts. There's so many things that wouldn't be covered. She's just paying it in case something else happens. She's now looking overseas, Madam Speaker, to see if she can find more affordable insurance coverage, right? And so this is why, I welcome what we're seeking to do here with National Health Insurance, but also I believe for those people who have been paying private insurance for years, the government must look into somehow seeking to cap these premium increases. You don't make premiums increasing every year. I tell you, my premium has been going up with my private insurer just about every year. Okay, they're inching up until they get to the point where you can't afford it anymore. Madam Speaker, people risk going uninsured or delaying treatment or seeking foreign providers because local insurance is becoming totally unaffordable and unreliable. So they call upon the government to regulate these hikes and somehow implement some independent claims appeal to protect policyholders. Madam Speaker, as I draw to a close, I know that the government has announced the runway extension at the Dedmanski Airport. And I believe this is a long overdue project, and it is critical for our economic growth and tourism and so on. But has the necessary land been acquired? That includes the Taylor family track on the other side of the runway. Gladstone Taylor and his family. Has the government secured the land? From whom and at what price? You have the Turnquests, you have the Taylors, you have a number of families who have land around that runway. And I haven't heard anything about that land being acquired. You know, I see a lot of talk, but I haven't seen that or heard that it's been acquired. And so without this, the project is just another empty promise to Long Islanders. And we're well beyond being treated as fools to be part of PR announcements. We want to know, because the only way you can do work on the runway is to acquire the land, and we want to know if that has been done. Madam Speaker, I also know that there's been, I said this last time I spoke in here, and I say it again, there's no budgetary allocation. Madam Speaker, may I have another 3 minutes or 2 minutes to conclude? Thank you, Madam Speaker. There's no budgetary allocation, Madam Speaker, for the runway extension or the major roadworks in Long Island in the current, or in the budget that was just passed in July. So I continue to ask the government, where's the money coming from? What's the source of funding for the runway and the airport projects? We want to know. The people of Long Island want to know. Or is the government guaranteeing some side agreement? We want to know. Madam Speaker, as I conclude, the government should seek to shift healthcare from hospitals into our communities. The thrust must be to drive down waiting lists and delivering better healthcare for working people. We need a national screening program for prostate cancer. There's a need for a targeted program, Madam Speaker, for most at-risk groups in this country. And that I believe that would save lives, prostate cancer, breast cancer, et cetera. And I'm going to be collaborating with Mrs. Iris Pinder and the Long Island Cancer Society to seek to arrange mammograms and screening for prostate cancer for some of my constituents. And I hope to speak to the member for Tall Pines to see how he can assist me as well with doing so. Madam Speaker, these bills promise transformation, and we look forward to it. We need more action. I never stand against reform, and I support healthcare modernization with action. Madam Speaker, I thank you.
Thank you, Honourable Member. The Chair recognizes the Honourable Member for Tall Pines.
Madam Speaker, I didn't want to interfere with Long Island's presentation, and I do appreciate the fact that he brings the concerns of his constituency to this place, which is a clear indication that he's doing his job. I want to speak specifically about healthcare because a few times prior he spoke about the morgue that we purchased, and the morgue was the wrong order. It was too big for the existing facility, and so it could not be installed. I can assure the member that the procurement process is already completed, and a contract will be awarded to a local Long Islander in short order to finish this work. I would also like to apologize to the people of Long Island because a week late is too late. But the circumstances was that the manufacturer sent a cooler that was not originally on the invoice, and it arrived in Long Island, and we're trying to make lemonade or the orange juice. And so I have to build a new morgue to house this facility, and I'm pleased to report to Long Island and to the member for Long Island that a contract will be awarded in short order to a local Long Islander. Thank you.
Thank you, Honourable Member. Asmini. The Chair recognizes the Honourable Member for Engliston.
Thank you very much, Madam Speaker. Madam Speaker, I rise to contribute to this debate. I hope I won't be too long. And I do so, I rise on behalf of the people of Engliston, whom I have had the honor to represent for 5 consecutive terms thus far, and addressing an issue that, I'm bragging, it's just a fact. No, but they to address an issue that is really germane to who we are as human beings, and it's this issue of our state of health, our health care, and a healthy being. I want to begin by commending the Minister of Health, the member for Tall Pines, who, as the Prime Minister indicated, has moved forward with great focus and energy and uncompromising persistence to address many historic issues that persist in our healthcare sector. Yes. And as he indicated, I think, and the Minister of Health did also, the member for Tall Pines, many of the issues we face are historic, and through neglect or lack of vision or lack of political will, which has brought us to the place where we are, where the rubber has hit the road in our healthcare sector, and one in which we must address as a matter of urgency. I also want to thank him again, and also the Minister of Works, for the Coconut Grove Clinic, which was closed under the former administration, never opened, and I was one, yes, who's the minister? True, Prime Minister. But we had to, I agitated quite a bit about this because this was a clinic that services a community. I heard the member for Long Island talking about this model about clinics and moving from the center of the hospital and going into the clinics. That has always been the model. It was the original model. But I have to say, in that model that he just sought to advocate about, they themselves were, they were derelict in the Coconut Grove Clinic in particular, because that clinic serviced 3 or 4 communities. And people who could have just gone there for primary health care issues didn't have that anymore. Didn't have that anymore. And so they had to, I think they were diverted to the Fleming Street Clinic, which is far away if you don't have a car or the resources to hire transportation, whether it's bus or whatever it is. And so this itself had an impact. I believe, we need to do the research to see how this impacted the state of health in these communities, because it became a disincentive to access primary health care. But I really want to say more than that, because that's behind us now. I want to thank the minister, both ministers, for the work that is underway. And I pass there again today, pass there almost every day, to make sure they're doing something. They're working to provide, to re-establish this clinic for this community. And state of the art, thank you, state of the art. The issue of health has always been a priority issue in the Bahamas, particularly in the early first Progressive Liberal Party government. And they emphasized the importance of health. I remember the billboard saying the health of a nation is the wealth of a nation. Yes. And this was something that was very aggressively promoted, that the population had to be healthy. And this was done through the access to the clinics, through the education process, and even in the schools, the entire information line, where you began to raise awareness about the necessity to be purposefully healthy, and for the country to be purposefully healthy. And because health is important, it deals with issues of productivity, because if you have people that are chronically ill, which we do, and plenty, that affects how productive we are as a country and as a people. It's important to individual well-being. You're sick all the time. It affects your mental health after a while when you are suffering severe health issues. And it also impacts families. Because if you have a loved one in the family who is suffering from chronic or major health issue, it's a downer. It's a downer. And so health is important. This is not a side issue. This is a central component to our human society. And so the bills that we're dealing with today that begin to coordinate and to rationalize how we approach the more complex issues that we're facing now in health is a very critical step. And when you look at and I think others have raised it, the amount of money that's spent in healthcare, even in the pharmaceuticals, we have the Pharmacy Act here, dealing with the huge draw on the public treasury for pharmaceuticals. It speaks again, this is another component, it affects the economy. Yes. Because you're now drawing to treat sickness as opposed to promoting advancement and progress in a much more robust way. So this issue is front and center to what it is that we are facing as a Bahamian people. And the truth is, we're a very sick population, and all the statistics, the data shows it. In fact, I was trying to find it online, but so much data has shown that the Bahamas is in front in the region in so many issues, in diabetes, in obesity, and in fact, in diabetes, we may be even outside of the region. We are outside way out there. So this is, when you see what poor health can do to everything, family, community, the economy, the productivity of a state, and then when you look at how in the Bahamas we are experiencing it more greatly in certain areas than other populations, this is a serious, serious state of affairs, and it's not acceptable. And so we must make a purposeful, aggressive, a determined effort to address what we are facing now in this country. And I was in a UWI council meeting, and one of the things they said, which was quite shocking to me, and I just looked online, and it says it again, in the Caribbean, we are the amputation capital of the world. And this is a product or an outcome that happens in particular with diabetes. And there's so much of it, so much. I believe in this parliament, but I don't want to get into people's private medical business, but this is throughout the country where people are experiencing issues related to obesity, hypertension, stroke, heart attacks, and the amputations which come with diabetes. And the worst part, I think, the dialysis that a lot of people are facing. And so we are truly, truly being impacted by this issue of poor health in this country. And the one thing I want to mention, I didn't hear it much in this debate, is the role of alcohol. There seems to be a public or national reluctance to call a spade a spade. Alcohol is probably one of the most deleterious, terrible factors, alcoholism, that we are facing in this country. Is also tied to violence, domestic violence, homicides, etc. And the liquor companies, they promote a lot of sporting events, and they sponsor and all of that. And so I believe there's a reticence to deal with it. But I think we have to have a really aggressive campaign on the issue of alcohol. And also, and I think there was that recent study which showed even children and young people being impacted by alcohol. And that is why when that liquor store opened up across from E.P. Roberts, I am angry about it, and it has to go. They have to move that. You cannot put a liquor store proximate to a primary school. What message are you sending? What psychic information are you planting in the minds of children? I was pleased to hear the chairman of the licensing authority say that going forward, they will publish where these licenses are being applied for and allow communities to make representation. But this in itself shows how we have not understood the impact of alcohol on a community to allow something like this to happen. Yes. A stone's throw from a primary school. So we need to talk about alcohol, diet, alcohol, and also other lifestyle issues. I believe the tobacco issue is coming, it's not as prevalent, I don't think so, as it used to be. So we are told that more than half our beds in the hospital are for chronic non-communicable diseases. So that means most of the patients going there are going for illnesses and ailments related to diet and also lifestyle issues. And so this is very important, that when we know the numbers, and we know the numbers are huge, it's important that that people are able to access health care. Now, I'm very strong on prevention, and the member knows that because I talk about it a lot. But if you're sick, talking prevention is, that's not relevant right now. You have to see how you can make people, cause them to get well again. And so and the word that I heard a lot in here, and it's a very important word, is equity. Because what our healthcare system has become, one in which if you have money, if you could pay that insurance that Long Island talk about, you could go anywhere, do anything, access anything. But if you don't have $1, okay, or if you don't have much dollars, being able to go and even do a diagnostic test is a major, and that's to just help you understand what's going on, is a major, major, major issue. And yes, the cookouts and all of that, I discourage people from doing cookouts because it seems to me it's like a drip, drip, drip. I say, let's try and find other solutions to address the issue. But people do what they have to, and it is pathetic that people who are sick and who are fearful for their well-being have to sit down and beg around the place for chicken and steak and whatever it is, and and enlist family members to go out in the park and to try and raise some money for health, for life-saving health care. This is really an abomination, and it's something that bothers me greatly. And I can tell you, many times I have to be eyeball to eyeball with people who are in this situation, and it's not good. It's not good. And so the fact that we are looking now to see how, at least in the standardized basic minimum access, which includes diagnostics and all of those things the minister spoke about, this is an important step ahead to take this off the heads of people who are facing life-threatening illness. So the issue of our schools, because I've heard a lot about that, and the minister and I were in a session the other day talking about schools, because once you start affecting the thinking of children and young people, when you begin to educate them and change their culture and the way they see things, you begin to change the world. And so there's a very heavy lobby globally to start in schools to cause for the inculcation of information and education for children and young people. And I wanted to say, because it's probably not known, there are compulsory standards for all schools. But the issue, I think, is compliance across the board. But I'll tell you, for example, there is it's the Bahamas School Feeding Manual 2023. And this was developed in conjunction with the Ministry of Health and FAO and the Ministry of Education. But just so you know, for example, in a tuck shop, for example, sodas are not allowed to be sold. Candies of any type not permitted to be sold. Savory snacks not permitted, and they include cheese doodles or cheese curls, chips, corn chips, Doritos. No chocolate. Chocolate bars, tuck shops. Yes.
You don't know about that. It's called them cafeterias.
Huh? No, that's what I started out by saying that. I wouldn't say it's not enforced that much. There are issues with enforcement in the schools. Candies, which includes soft candy, licorice, fudge, mint, toffee, marshmallows, Chico sticks, chewing gum, cups and baggies, Kool-Aid-based beverages, sweet drinks and fruit-flavored drinks, flavored water, sweetened drinks, beverages, and punch, frozen icicles not made from 100% juices. And what they're approving in schools is 100% juice, no sugar, 2% milk, chocolate milk, not drink, whole grain cereals, for example, Chex, Bran Flakes, Honey Nut Cheerios, Raisin Bran, fresh fruit, hot patties, chicken, veggie, to be prepared without trans fat. And the minister spoke the other night when we were at an event, and he talked about trans fat acids, what do you call it? Trans fatty acids, and how it's in almost everything we eat, much of what we eat in processed foods, and how it goes into the system and latches on to the arterial system. I'm right so far, Doc? Yes. And after a period of time, you have a buildup of plaque, which narrows the artery that blood has to go through. And you have a little bit of stress, and that shuts down on you. And you know, around here, we get more than a little bit of stress. Just driving on the road is stressful right now in New Providence anyway. So this does not allow for trans fatty acids, dried fruits and nuts, ice cream, grits, cornflakes, tuna, egg, cheese, turkey, etc. So we do have a plan. As I said, there's an issue with compliance. And so what we have decided to do is I call it a health guru guru to bring on board in the Ministry of Education someone who is going to ensure that, one, it's in the curriculum, that we begin to educate children on how food is related to health. We're going to ensure that that guru will ensure there is compliance with this manual that I spoke of. They will ensure there is effective implementation in schools throughout the nation, and to ensure that there's public education. So on the issue of, I think the member for Kalani spoke about sports, and I just wanted to say to him that after collaboration with the Minister of Youth, Sports and Culture, the member for Garden Hills, we have or are nearing the completion of a structure for sports development, which will have a dual function. One is to ensure physical well-being and movement, which is what is recommended as part of your health regime, and secondly, to identify premier athletes. So it will have that two-pronged effect, but we are well advanced in implementing this in a way in which we have not seen before. So between the two functions of the manual, which was done in 2023, the person or the inspector, whatever we call this person, who will be responsible to go and ensure compliance, which includes education and the curriculum to our young people, and the physical education component. We are hopeful that over, I hope, short to medium term, we will begin to see a reversal of some of the major health issues, and I say major health issues that we are seeing with children and young people. I spoke to a constituent last night, and she told me her 21-year-old son is hospitalized with a suspected stroke, 21. And this is what we're seeing now with children and young people. So we're hopeful that in conjunction with what the Minister of Health is doing, what the Ministry of Education is doing, that we begin to turn around what we are seeing in a very serious, critical crisis issue in the Bahamas. And this is a crisis. We have a health crisis in the Bahamas. And so, the issue of the dental health legislation, I just want to say I think for many people, they do not make the connection between oral health and overall well-being health, the health, overall well-being or well health. And there is a direct connection, even in just digestion, how your mouth handles food, how it goes through the body. This is critical. But it also has other serious issues, including poor oral health can also impact heart disease and other aspects, other serious issues. And so we have to really, in our schools, begin to inform young people and children the importance of dental health care. Brush your teeth. Don't go to sleep without brushing your teeth. And the issue of candies and all that in your teeth, because it's not just a cosmetic thing. It actually is the beginning of health, overall health, in terms of digestion and elsewhere. And so we really have to be much more aggressive in advocating for awareness about the importance of dental health care. And then I just wanted to say a little fun fact of the Angliston Urban Renewal. We are, that Urban Renewal Office, they have a session every week for elderly persons. It's an exercise class for elderly persons, and they're seated in their chairs, and they're doing this and doing the legs up and all that. And every week they come faithfully to exercise, which tells you also, even at the latter ages, the importance of physical movement and physical well-being, and the ability to attain it safely. So I wanted, and the last thing I wanted to say is the issue of breastfeeding. I talk about it a lot. It's not directly related to this. Dr. Darwin, the member, knows that I talk about it all the time. This is really the beginning of good health, because there has been, studies have shown the correlation between breastfeeding and chronic non-communicable diseases. So even at the early stage of life, breastfeeding has the ability to give a child or an infant a strong start in the mix of these diseases that we're seeing. And so I always seek to promote and to advocate for breastfeeding for new mothers, at least 3 months, 6 months, 12 months. For many, it's inconvenient, which it might be, but it's a very short window. You bring a child here, let's give your child the best chance, yes, at a healthy life. And a lot of women say, oh, I ain't had enough milk, or it was too hard and all that. It can be difficult in the beginning. You have to stick with it until you get over the hurdle and the challenges in the initiation of breastfeeding so that you're able to carry it out. And so we need to talk more and to encourage more mothers, and husbands and fathers need to encourage the mothers and to support the mothers in breastfeeding, because it is critical on this issue of CNCDs, but it's also tied to issues of immunity, to IQ, and to the child's sense of security. So it's just a miraculous thing. Plus, it's a perfect food. God knew what he was doing. It's a perfect food. The only thing it lacks, I think, is iron, and babies don't need iron. It's a perfect food, and ain't no formula could match that. So we really want to encourage that. Breastfeeding is a major pillar in good health in the Commonwealth of the Bahamas. So I just want to end by saying that this is a very important step that we're beginning to expand. We still have out there the elephant in the room, which is catastrophic illness. And that is something that is, and because we're such a sick population, there's so many cases of this, and catastrophic illness is called catastrophic for a reason, because the resources required to deal or to address that illness and that patient are incredible or significant. And so that is something I hope the minister says he has some limited approach that can happen, but at some point I'm hopeful that we're going to be able to address those who face life-threatening major illness, because if you don't have a dollar, it must be very daunting for that person. So, but we're beginning now with these reforms, which I hope will begin to take us towards a more comprehensive coverage. But in the meantime, we have to work on the state of health in this country. We start with the children of this nation. We do it in the classrooms and the schools, where we begin to get into their psyche. And the challenge that they will have, which is a challenge we all have, is that our culture, the economy, the member for Kalani talked about fast food businesses, everything is surrounded by this thing. We were saying at the meeting we had the other night, you go in any store at the cash register, that's where there's ketchup, chocolate, candy, this, that, the next, right there. You done getting ready to mark, and you take one little look on the side there, and you marketing. But this is what we are bombarded. So it's not easy. It's not easy, and so this is why we have to purposefully advise or inculcate young people so that they make conscious decisions despite what they're immersed in around them, that they're able to create a pathway for themselves that promotes good health. And so I am very pleased. I look forward more than anything to the promotion of health components. And just to remind everyone, the objectives of this act, Clause 3, to establish the administrative framework for accessible, affordable, and quality standard health benefits or other health benefits for beneficiaries. 2, establish the standard health benefits as the minimum standard of coverage across all sickness and health insurance products. Provide equal opportunity for public and private sector participation in the provision of standard health benefits or other health benefits. Enable, 4, enable the sustainability of standard health benefits or other health benefits through appropriate allocation of resources. 5, promote efficiency in providing standard health benefits. There was a question about bottlenecks Efficiency is a mandate of this legislation. And finally, to improve the overall health of the population. And this should have been number one, but it's way down here. To improve the overall health of the population of the Bahamas by the attainment of universal health coverage. Yes. This is an important step in our national agenda. It is consistent with the ideology and ideals of the Progressive Liberal Party. Yes. From day one, yes. Consistency on this issue. And so I am very pleased to enlist to these ideals, which are my core belief, and all of us who subscribe to this, to these ideals. No disrespect to the Free National Movement, who ain't got none, but no disrespect, no core ideals. You have some ideas here and there you put together. But in terms of an undergirding, yes. philosophical drive, which the Progressive Liberal Party has. Yeah, you came from us. Y'all got watered down. Like, that's okay. Yeah, you came from us. No, but the only point I make, I sort of teasing in a way, but not too much though. The truth is, the Progressive Liberal Party, you go back to the original Constitution, it's consistent. So everything we do is tied and linked to an undergirding philosophical positioning. Yeah. And sometimes we're not faithful. And when we're not, when people see it and they say, man, I can send you alone, you catch yourself, we might bring you back. And so they bring us back. But consistency and commitment to the core ideals, this is the party of the people. This is the truth. I think the Prime Minister said the party of the, I forget how he described it, but we're the party of the people. And so I am proud that this day we are beginning. This is only a beginning. This is no crown yet, just the beginning. Thank you very much, Madam Speaker.
Thank you, Honourable Member. Asmini. The chair recognizes the Honourable Member for Yamacraw.
Thank you. But I enjoyed it. No.
You may proceed, Honourable Member.
My bad. Let me get the other one.
Mr. Deputy, thank you for this opportunity to rise in this honorable place. I begin by giving thanks to God for the honor of serving His people, and to the great people of Yamacraw for sending me to this honorable house. Thank you. Mr. Deputy, please permit me, I don't intend to be long. I've been known to condense my contributions when necessary to within half my time. I'll try to do my best to do better than that today. But it's important that we indicate the importance of this bill and to indicate that our people are one step closer to achieving universal health care under a Progressive Liberal Party government, which was, as the member from Angleton said, the original design. Mr. Deputy, as an administration, we never took a day off. Unlike our predecessors who promised the people's time and then took a few months off as their first move, and then raised by 60% as their second move. this opposition that we would have heard from today that had issues with how far we went in the bill has the history of talking with no intent to back it up. Therefore, they took whatever we do, or they take whatever we do and oppose it, or they speak doom and gloom over it, or they say we could do more. Today, we are at 2, and I would just like to point out my case by supporting documents. Well, today, the member for East Grand Bahama said that the provisions of this bill is not enough, in his words. He said that by adding more people to receive quality health care is a bureaucratic tsunami that could bury the people we plan to help. I found that as a very peculiar statement because it's suggesting that in an effort to be helpful, we could bury some of the people we want to help. I mean, it's so extreme to me. I would think that in anything that we choose to do, we could point out that there's a negative part of it that could be harmful. But we choose not to look at things in those lenses, Mr. Deputy. He added that by adding thousands to the health benefit list, this is his words, I'm just saying, he said, we are inviting chaos. And Mr. Deputy, yes, we lament the challenges of our public service system, but we have also outlined how we intend to address and clean that up. And so for the suggestion to always be so doom and gloom from the other side is just a consistent behavior that we are seeing, that we have seen earlier today. Then a suggestion was made to remove VAT of all healthy food items. This is what he said. And admit that they changed their minds about their bread basket list that they were pushing for the last 3 years. I found that interesting also, but I'm happy to hear that the member from East Grand Bahama admit that they changed their minds from bombarding us with 3 years of bread basket, especially after we exposed the extent of their bread basket list, which included no healthy food items, as promised by their Minister of Health also, whilst all of them seated there were in the administration. However, Mr. Deputy, our Minister of Health, Honorable Member for Tall Pines, reminded the Bahamian people that just the other day, when they were in power, they had all talks and no healthy foods were on their VAT-free list. No fruits, no vegetables, no vitamins, no meats of substance. And I draw attention to the double talk of the administration because as facts, we have to always remember that facts are stubborn things. There's an article that's dated January 13, 2025, earlier this year, that was printed in the Nassau Guardian entitled The F&M and VAT. And I'm going to just read some excerpts from this as it pertains to this subject. And the article reads, as urging the government over the past 2 years to remove value-added tax from bread basket items and calling for healthy foods to be VAT-free, the Free National Movement was quick to slam the Prime Minister's announcement of 50% tax reduction on food in grocery stores as falling short of the bold relief the public expects. Again, at that time they said we didn't do enough. Prime Minister Philip Davis made the announcement in an address last Wednesday night, as the article goes on, acknowledging that VAT is not the primary driver of high food prices in our country. While welcoming the Prime Minister's announcement, we too made that acknowledgement and noted that high inflation will remain even if or with the VAT cut. In a statement not long after the Prime Minister's address, F&M leader Michael Pintard said, quote, the F&M has consistently advocated for the complete removal of VAT on healthy food, bread basket items, medicines, and feminine hygiene products, an expansion of the policies implemented during the last F&M administration and reversed by this PLP government, close quote. Pintard, of course, was wrong, the article says. He was wrong in claiming that the F&M had removed VAT on healthy foods. He rather amended the statement later after the Nassau Guardian highlighted his inaccuracy. During the budget debate in Parliament in 2019, Dr. Dwayne Sands, then Minister of Health, announced the Bahamian people will touch in their cupboards and feel their wallets the work done over the last fiscal year to make healthier food options more affordable through a reimagined and less obesogenic bread basket. Specifically, Bahamians can look forward, this is what he said, quote, quote, specifically, Bahamians can look forward to spinach, broccoli, romaine lettuce, apples, oranges, strawberries, beans, peas, almonds, and so much more, not only VAT-free, but price protected. And the article says it would have been wonderful if the F&M administration had kept its promise, but of course it did not. Sands, now chairman of the F&M, recently called the Davis administration to eliminate VAT on healthy food, or he called on the Davis administration to now eliminate VAT on healthy food. And Mr. Deputy, I just wanted to make reference to what was said in response to our laying of these documents today, or our debating these documents today. The opposition always wants us to go further. The member for Freetown always indicate that if we pave 100 miles of road and left 1 mile unfinished, they will highlight, oh, y'all ain't paved a mile of road. But we are not into negativity, because we rise, and I rise today in support of this compendium of legislation tabled in this House by the honorable member for Tall Pines and the Minister of Health and Wellness. I shall not be distracted, St. Barnabas. Debating one significant bill is no easy feat, and I applaud the good member for opening the debate on these 5 essential bills with clarity and for his commitment to advancing a transformative health and wellness agenda for the Bahamian people. Mr. Deputy, the vision of the Ministry of Health and Wellness is the optimal level of health and well-being for all citizens of the Bahamas. These bills not only bring us closer to the actualization and vision of health in the Bahamas, they also fall in line with the health and wellness priority of this Davis-led administration as set out in our Blueprint for Change. We know that health is the foundation of national development, and for national plans to be successful and sustainable, you need a society where people are healthy and are able to thrive. These bills seek to improve the quality of life for Bahamians across our archipelago. In my contribution to this debate today, I would begin by speaking on national health insurance and very quickly outline that NHI 2025, under the NHI 2025, this is a new era. It is not a new idea, however. It is a vision long championed by the Progressive Liberal Party, rooted in the belief that every Bahamian, regardless of income or location, should have access to quality health care without financial burden.
Yes.
Mr. Deputy, no individual, no family should be pushed into economic hardship because of an unexpected illness or injury. In 2016, under a Christie-led PLP administration, the groundwork for NHI was established, initiating the framework for universal health coverage in our country. As with any new concept, particularly a national initiative, the initial program achieved some successes and faced some challenges. Today, under the leadership of this Davis-led administration, we are not simply continuing that important journey, we are also strengthening, expanding, and advancing the program to meet the current, future health needs of our people. Since 2016, almost a decade ago, our population has increased, technology has improved, and our lifestyle practices have changed. However, non-communicable diseases remain a persistent and costly burden to health systems worldwide. Health and wellness are key components to the social and economic strength of any society. For this reason, Mr. Deputy, the introduction of the NHI Bill 2025 to repeal and replace the 2016 Act is both timely and necessary. This bill creates a unified legal framework under the National Health Insurance Authority and expands standard health benefits to include a broad package of preventative, primary health care services, pediatric, maternity, and adult specialist services. The electronic platform or electronic health platform will coordinate claims, patient records, and provider payments, thus reducing administrative delays and improving data security, making care more efficient and accessible, especially for those in our family islands. Mr. Deputy, the citizens of the Bahamas or a lawful resident under the Immigration Act, Chapter 191, registered with the National Insurance Board and in possession of a national insurance card are eligible to enroll in the plan. Even those with private insurance may enroll if they meet the requirement. While the cost of standard health benefits shall be paid by an individual's approved private insurer, if for some reason the insurance is discontinued, the authority shall provide benefits unless otherwise notified. I encourage all eligible Bahamians across the length and breadth of the Bahamas to speak to the healthcare providers about NHI or visit the NHI website to understand the benefits that are associated and are available to them and become a beneficiary of this program. Life does not give us a schedule for illness or emergencies. And this bill ensures that when those moments come, health care will be accessible, affordable, and available when our people need it. I now turn briefly to the National Health Insurance Specified Chronic Diseases Prescription Drug Fund Bill 2025. The Pharmacy Amendment Bill 2025 also, and the Dental Professions Bill 2025, which are part of this compendium. They also promote health and wellness and provide avenues to assist with the management of chronic diseases. Together, they strengthen the quality, regulation, and accessibility of care. The NHI Prescription Drug Fund Bill ensures that persons living with specific chronic diseases can access essential medication free of cost under NHI, reducing the financial strain of long-term treatment and helping to prevent serious complications. Similarly, the Pharmacy Amendment Bill updates the legal framework to include electronically transmitted prescriptions, thus advancing the dispensing of medicine, improving patient safety and services across our islands. Maintaining our oral health, as recently mentioned by the member for Angliston, is just as important as maintaining our physical health. And it's amazing that this just coincides with Mr. Deputy, a physical that I would have had to do during the break. And I did my annual, and the first thing they asked me was, when last did you have your teeth cleaned? When last did you have oral exams? So I want the general public to understand that these things that when I was growing up, there was never really a connection put, even though that might have been known by the medical professions. There wasn't a connection put to oral care and your health. At least not, it wasn't that closely linked. So you always saw the dentist as extra care. And I'm proud to state that under this administration and through negotiations with our very capable Minister of Public Service and Labor, your unions, more unions have access to vision and dental. And because I mentioned the Honorable Minister, I know I get an extra 2 minutes from my 50 and I say it's going to take. But I think that it's important for us to notice. Yes. So it's important for us to note that there's a connection, there's linkages here. Mr. Deputy, the Dental Profession Bill modernizes the regulations and licensing of dentists and dental auxiliaries, ensuring that practitioners meet the highest professional standards and that Bahamians have access to oral health care across our country. While the NHI Bill 2025 focuses on making healthcare accessible, equitable, and affordable, I now turn briefly to the Health Promotions and Wellness Bill 2025, which seeks to address the equally important goal of keeping our people healthy in the first place. Through preventative measures, this can happen. This bill establishes the national framework for promoting healthier lifestyles, preventing diseases, and empowering communities with the knowledge and resources to make better health choices. It formalizes behavior change, interventions, public health education campaigns, and targeted initiatives to combat non-communicable diseases. Research tells us that the non-communicable diseases are largely preventable, and we heard that today, and that unhealthy habits increase the risk factors for these diseases. Unfortunately, we are bombarded daily with the radio, television, and social media advertisements that encourage unhealthy eating and practices. We must counter with attractive alternatives. Even more, and here at home, it has been noted that the most recent marketing strategy of some takeout places is that they have the line, "See you tomorrow." Before, it used to be, "Come again." However, I suppose that this is a new line that better trends the way that they want things to go and fills the quota of repeat customers, and therefore, the message had to be made more specific. And therefore, the message, when making the statement, "See you tomorrow," as a parent, and sometimes trying to pick up a quick bite for my children, I think in my mind, well, I hope not, because I want my children to grow up on healthy living, healthy lifestyles, and healthy food. The fact is that if people continue to follow these marketing strategies and are in the drive-through or on a fast food line every day getting food that is high in fat, salt, unhealthy fat, salt, high cholesterol, and high sugars, then that is a serious issue. It takes willpower to resist the convenience of takeout, especially at the end of a long day when going home to start cooking seems draining and tiring. Even if I'm getting some of the healthy items every day and eating out every day, then I am not in control of my well-being. Mr. Deputy, as I wrap up, this bill empowers the minister on the advice of the National Food and Nutrition Commission to assess the foods and beverage products in entering our country and impose limits, enforce bans, or propose fiscal measures to address their harmful effects on health. This bill mandates the health in all policies approach, which encourages collaboration across government ministries, community groups, and private sector partners to ensure that policies we enact are in areas like education, agriculture, social services, or tourism support and strengthen the health and wellness of our people. As a nation, we must shift our mindset from simply treating illness to actively preventing it. This change will reduce the burden of chronic diseases, lower healthcare costs, and enhance productivity across our economy and population. This mindset shift requires us to prioritize health and our quality of life. That means making deliberate choices like eating more healthy, nutritious foods at home, staying physically active, getting regular health screenings, and breaking free from habits we know put our lives at risk. Mr. Deputy, the 5 bills debated today touch the everyday lives of Bahamians. They are designed to make health services more accessible, affordable, and health systems processes simpler. A healthier population means more children in school, more parents able to work, and more seniors able to enjoy their retirement years with mobility and dignity. In Yamoussoukro, we are doing our part to promote healthy living. Our bi-weekly Farmers and Craft Market enhances the farm and greenhouse, and enhancements of our farm and greenhouse are part of the initiative. Our development of 8 vegetable raised beds through BAIC helps in that initiative. Our Yamoussoukro Urban Renewal Seniors Exercise classes help in that initiative. Our Yamoussoukro National Tree Planting under the patronage of Lady Davis, the spouse of the Prime Minister, helps in this initiative. Our Men's Health Month and Fitness on the Park and health screening during the months of June, recognized as Men's Health Month, helps in this initiative. our Cancer Awareness Fund Run Walk coming this October, and that we've been having for the last 3 years, and donations to the Cancer Society and sister support groups helps in this initiative. And soon to come, a mobile gym that will move from park to park in Yamacraw. Yes, we will continue to do more. To Tall Pines and Golden Gates, thank you for your excellent delivery on the motions to move and second this bill, and all of my colleagues for their contribution to this bill this evening. Yamacraw supports this compendium of health bills. Thank you.
Thank you, Honourable Member. As many? All of them speaking? The chair recognizes the Honourable Member for St. Barnabas.
Thank you very much, Mr. Deputy Speaker. Thank you very much, Mr. Deputy Speaker. Mr. Deputy Speaker, I rise on behalf of the great people of St. Barnabas, represented by the communities of Coconut Grove, Black Village, Big Pond, Rock Crushing, the Oaksfield community. Grateful, Mr. Deputy, to Almighty God for allowing me to see another day on this earth in our beautiful country, Mr. Deputy. And I am grateful, Mr. Deputy, that in just a few short days, our 8-month-old will soon be 9 months. And so he is now coming into his own, taking his first steps. And my wife and I know that there are great things ahead for him, just as it has been the case with the older children, Mr. Deputy Speaker. Mr. Deputy Speaker, I'm kind of reflective today, very reflective today, as a number of members would have likewise done the same as it relates to this particular issue and broadly the issue of public health and health in general in the Commonwealth of the Bahamas, Mr. Deputy. Mr. Deputy, so I come here today seeking as a part of the opposition, seeking no claim to have a monopoly on ideas and policies which are good for our nation, but I stand with a commitment along with my parliamentary colleagues on this side to be a part of this legislative body to offer constructive critiques of bills that come before this honorable House. This is not a political consideration. It is a democratic obligation where we deem appropriate to call the government into account, make recommendations as agitated by stakeholders and Bahamians far and wide, whose voices will be heard through this opposition. Truth is, Mr. Deputy Speaker, in their most recent and past versions of an opposition, they too asked the same questions we have asked on many occasions, questions that now they refuse to answer, the very questions they once asked. But Mr. Deputy, as we debate these important health bills, preparations are underway for the 4th high-level meeting of the UN General Assembly on the prevention and control of NCDs. In September of 2018, at the United Nations 3rd high-level meeting on non-communicable diseases, I had the distinct honor of delivering then Prime Minister's remarks on behalf of the Commonwealth of the Bahamas at the United Nations. While the magnitude of the rare opportunity to address the United Nations did not escape me, the global fight, and particularly our nation's fight against NCDs, streamlined my perspective on our nation's healthcare apparatus and the health of the Bahamian people. Every subsequent conversation with world leaders or diplomatic representatives was centered around their nation's economic development, and its direct impact on its national healthcare system. Similarly, Mr. Deputy Speaker, this debate on these compendium of health-related bills is similar in nature as it intersects at the cross-section of the Bahamian economy. Every policy, every promise, every suggested plateau as projected and uttered by this government is diminished if the fundamentals and future prospect for the Bahamian economy is not anchored by real robust growth, diversity, and an appreciable expansion that meets the real needs of our people. So it is reasonable, right, and relative to ask today, as the government comes to talk about what they deem as legislative progress on matters of ensuring the health of the Bahamian people, what is the status of the economic health of the Commonwealth of the Bahamas? Does the economy provide sustainability to secure the healthcare structure we are justifiably adding to? Because as has been stated from the outset by the member for East Grand Bahama, we support these bills. How what has been put on paper in legislation will ultimately interact in real life and real terms for the Bahamian people? It is a legitimate question, Mr. Deputy Speaker. How does their shifting, unreliable economic numbers on the surplus, on the deficit, affect the bottom line and line up with their promises on health care, Mr. Deputy? Mr. Deputy, even as we speak, we understand that employees of the Public Hospitals Authority can't get paid. The question, are nurses paid? Providers in the National Health Insurance Program are complaining about delayed payments. These are legitimate concerns that affect our ability to provide consistent health care service, Mr. Deputy. So, Mr. Deputy, and the honourable member for Angliston, in my view, really tapped in, because this conversation that we're having today really, it would have been good if we all could have had an hour. When you think about the gravity, not that any other bills is less important, but the gravity of what we talk about and the complexity of what we talk about here today. Because once you get started in one aspect of this debate, you can run miles and miles and miles justifiably. But one of the things I appreciated about what the member for Angliston talked about and where I'm about to go, and I really wish, Mr. Deputy Speaker, at times there could be a spot in the middle of this floor in front of the desk here as a symbol that you are trying your utmost and your endeavor best to not be political and not ascribe blame as much as you're trying to bring attention and a proactiveness and proper response to particular issues. So I say again, I wish there was a spot in the middle of that floor as I make these particular comments, Mr. Deputy Speaker. Mr. Deputy Speaker, I'm sure today, and a number of members have talked about it, we all can think about family members who have passed, family members who are right now challenged in coping with non-communicable diseases. Mr. Deputy Speaker, we have been dealing with these issues for decades. And while obviously persons like the member for Tall Pines, who is a medical doctor, have been, and others, the member for Kalani, who have obviously been on the front line and continue to be on the front line of the impact of the challenges of non-communicable diseases on our people. For those of us who are not medical professionals, we've seen it play out in our daily lives. We've seen it play out, the challenges that our healthcare system faces. And while I'm on this note, let me say too that we fully support and commend the hard work of the medical professionals, both in the public sector and the private sector. And I do believe that, particularly during COVID, persons would have gotten even more of an appreciation of the work that our medical professionals commit themselves to on a daily basis, Mr. Deputy Speaker. But we do have a problem, Mr. Deputy Speaker, that continues to rage in the Commonwealth of the Bahamas, Mr. Deputy Speaker. The member for Tall Pines has talked about it, and all governments have had challenges as it relates to some aspects of public health in the Commonwealth of the Bahamas. You know, we have issues that persons talk about daily in terms of their experiences at PMH, even with the best efforts of all of the professionals and so forth. So you hear about staff shortages and overcrowded ER, canceled surgeries, and idle operating theaters, and broken equipment and lack of equipment and so forth. So we have to ask ourselves, the Free National Movement and the Progressive Liberal Party, as governments, opposition, and whenever it switches, we have to ask ourselves, what can we do? How can we be even more diligent in ensuring that we fix these issues in a real substantive way, Mr. Deputy Speaker? I was talking to a constituent the other day, and I'm sure the member for Tall Pines is probably aware of it. I mean, though it may be let's just say, a small item in the scope of things, but nonetheless a very important item, that if you go onto the critical care block and you go to the men's restroom, there are still urinals that have been sitting broken for a very, very long time. Now, that may seem like a small issue, no doubt, when you talk about other things that needs to be addressed. But clearly for the public and many persons, that is symbolic of an issue that continues to plague our system, that even the restrooms themselves can't be addressed adequately. And so we must do more, Mr. Deputy Speaker, to address these issues, and particularly governments. And this in particular is where I wish I was in the middle of the floor, because when you talk about how we spend and what we spend on, right, and obviously the Progressive Liberal Party is the government now, but I'm sure when we were the government and past governments, there were opportunities where the Bahamian people might have felt the same way, that there seems to be, in the minds of the Bahamian people at times, a lack of focus on what may matter most, Mr. Deputy Speaker, that we talk about all of these challenges that we are having in the healthcare system, that obviously this is a part of the process today to bring remedy and bring solutions to some aspect of the healthcare experience in the Commonwealth of the Bahamas, and that's why we support it. You know, as the member for Yamacraw said, yes, we have said that some aspects of it and its execution has not gone far enough, and that's fair to do that, Mr. Deputy, because it's always about how can we be better than we were yesterday, an hour ago, a minute ago. How can we be better, Mr. Deputy? And it is our job as an opposition, in the true spirit of democracy, to highlight these things where necessary, Mr. Deputy. Mr. Deputy, we talked about it today. We heard it a lot today. This issue, there's a fundamental issue of, and Tall Pines talked about it, that, and albeit he did it on his seat, and so I'm sure he wouldn't mind me saying, because I thought it was a very positive thing what he said, which is, you know, we have to ask ourselves, firstly, how can we change our lifestyles to ensure better health? That's the first thing that every person has to ask themselves. And yes, there is the question as we debate about the healthcare system and where there are concerns. I'm glad to hear the member for Angliston talk about what is being done relative to the schools and the tuck shops, Mr. Deputy. And the thing is, you know, while alcohol and certain experiences with alcohol and what alcohol can do, always will tend to be more offensive to any person for a number of reasons, because we know the social impact of alcoholism and its impact on families and so forth. But when it comes to our health, sugar and sugary items and sugary products are a dangerous, dangerous thing, Mr. Deputy. You know, and I will say, Mr. Deputy, anecdotally, that as I patronize, and my family and I patronize a number of eateries and restaurants and so forth, you are seeing a commitment to present, at least on a menu, some more healthier options on menus. The question is, how many of us are taking advantage of those healthier options, Mr. Deputy? And for us to fully appreciate that, and this is always a tough thing because, you know, besides someone's church and John Canoe and their politics, the next thing Bahamians don't want you to mess with is their food. And that's real. And so we have some built-in inherent cultural challenges as it relates to lifestyle habits, Mr. Deputy, you know. So a plate that has some meat, potato salad, macaroni, rice, right, Dr. right, Tallbines? And then, to top it off, we wash it down with a 12-ounce soda. One of my oldest daughters always said, you know, and as I have my challenges of trying to eat healthy, you know, I might try a Diet Coke. And she would say, boy, Daddy, you're only fooling yourself. Yeah, that label got you, Diet Coke. But the point is that the informing the public, educating the public on these issues needs to be a constant priority, Mr. Deputy, because similar to the issues with crime in the Commonwealth of the Bahamas, if we don't get to the root problem, Mr. Deputy, as in the case with crime, we'll be building prisons for decades. Similarly, if we do not attempt to get hold in a real significant way on the root causes of the non-communicable diseases, Mr. Deputy, and how we live as a people, we will be building hospitals and getting all of the requisite machines and so forth for decades and decades to come, Mr. Deputy Speaker. You know, you know, my father always used to tell me that, boy, you got that salad, that's a good thing, but what do you do when you get the salad? You drain it with salad dressing, right? Drain it with salad dressing, and now you would have negated some of the health benefits, right? Some of the health benefits. And all that does is just make you feel good that man I eating salad. But then you drain it with some Thousand Island or some blue cheese, Mr. Deputy. And though, Mr. Deputy, you know, it's humorous, but it's a real serious issue as it relates to, again, eating habits and, again, lifestyles, Mr. Deputy, and how we conduct our eating affairs in the Commonwealth of the Bahamas, Mr. Deputy. My grandmother, Mr. Deputy, died at 56 in 2000 with breast cancer. 56 in the year 2000. And now my aunts in particular, as a number of them would have passed the 56-year-old mark, it's a constant reminder that they've lived longer than their mother. And so, again, I share that because we all obviously have stories of loved ones who've been affected in different ways, Mr. Deputy Speaker. And so the public education the public education and the necessary and hard conversations, Mr. Deputy, about what can we change. And some of it is hard. Some of it is hard. Because when you're talking about creating something that will act as a disincentive to acquire a particular food product, now you start to talk about conversations about how does that impact business. And I'm not suggesting that that means you don't have the conversation. I am actually amplifying the fact that we have to deal with some real decisions as it relates to living healthier lifestyles and what governments can do. What governments can do to help this along. No doubt, individuals must make a commitment to live a certain life if they want to live longer. I can remember, I don't know, there was a gentleman named Big O. You know, when Big O used to train me, rest in peace. And one of the things Big O used to say to us men in the gym, and this might fall in the category of public education, but it was an incentive. It was an incentive to live a certain way, operate a certain way, diet and exercise. He would always connect exercise and what we put in our mouths to men's sexual health. And that is real, Mr. Deputy. And so again, just making the point again that finding ways, besides the obvious fact of wanting to live longer, because I even find myself as I stand here, Mr. Deputy, and as I mentioned with a 9-month-old, there's no doubt, you know, I want to live longer to see him and my 6-year-old grow up to do some big things in their lives. So you want to live longer, to see more of life, Mr. Deputy Speaker. Mr. Deputy Speaker, this morning, the member for East Grand Bahama would have highlighted a few things that I wish to before I take my seat, Mr. Deputy Speaker. You know, when we talked about this, it was clear, and I know the honorable member for Tall Pines, you know, would have said and probably would reiterate again that regulations are coming and so forth. But on the health and wellness bill, the member for East Grand Bahama was asking specifically what does the bill remedy when those things, those objectives and those goals in the bill can be easily achieved through present-day legislation and departments within the Ministry of Health. And I believe that that is a real and legitimate question. There's always the question, too, and I believe that the member for East Grand Bahama, though the member for Yamakro, I heard him quote him, but I think that the spirit of what the member for, I know the spirit of what the member for East Grand Bahama, because we would have had discussions prior to this debate, is the question of not that you not do it because of the question of the stress test on the system, but to put in front of us the reality of that as we make these changes and as we increase access to health care, there is a fundamental question of, as you increase access, the stress test, will the system, and you ask this question so you know how to act, will the system be able to efficiently deal with all of the persons now who would be onboarded? That is the fundamental question. And if the answer is you're not sure, or the answer isn't absolutely, then it means now you must figure out ways to ensure that if you have more persons who need scans and more persons who need x-rays, that's a good thing. That's a good thing that people are getting access. The question is the infrastructure of our system and the system that we intend to create with these very important bills. We must ensure, not just hope, but we must ensure that we are doing what we need to do to make sure that, yes, access is one thing, but we want to make sure that the health care is efficient and timely, Mr. Deputy Speaker. Because again, as has been the case with many days in here, legislation and things in theory are good and important, but really the true test of the legislation and the decisions that we make is in real time how the lives of the Bahamian people impacted, even with your best intentions, how will the lives of the Bahamian people be affected in real time in terms of its execution and what it is that we are trying to do. The other aspect of this as it relates to national health insurance is, and I talked about it earlier, you have doctors now who are talking about delayed payments. Delayed payments. The Pharmaceutical Association, I know that they would have spoken to the government about their concerns. So the question is, if we are all stakeholders in this, as we are, the question is, and should always be, how do we ensure that we are addressing the concerns of all of the stakeholders? Because yes, it is about that Bahamian who has now access that they didn't have before, but it's also about that doctor, it's also about that pharmacy. How does that experience affect or is affected by how we execute what it is that we are trying to do relative to these pieces of legislation this afternoon, Mr. Deputy? Because at the end of the day, if the system is not efficient and it's not adequate, the very thing that we are trying to avoid, we may find ourselves, one of the unintended consequences is now there is some deficiency that's causing the access to either be prolonged or delayed, which now creates another problem. And I believe that that's fundamentally the objective question as we go along and we make these changes, again, that we support. How do we deal with the blind spots that may exist? Because again, there's always a question of, outside of the public health care realm, there's always a question of, we start things, and we're not suggesting that we not do it. What we're saying is, we start things, but then we don't make the necessary adjustments. And this is big, this is important for the Bahamian people, and so we have to continue to be vigilant and diligent in ensuring that as we go along, and there will always be, when a system, you're going to be getting a new system, so to speak, there will always be tweaking and adjustments, modifications. So what we are saying is to ensure that we stay ahead of the game, so to speak, if I could use that term, Mr. Deputy Speaker, stay ahead of the game on what potential pitfalls and challenges we can see right now, given the fact that we see the challenges that we are facing in other areas of healthcare in the Commonwealth of the Bahamas, and the challenges that the Bahamian people are facing. And Mr. Deputy, before I take my seat, I do want to talk about, I know the member for Tall Pines did get up on his feet and talk about it, and it's good that he has talked about and addressed the, at least preliminarily, the issue of the labor ratio, the construction of the hospital, because I think that Bahamians who have been used to a better ratio, that the 50-50 ratio that's been talked about, though the member for Tall Pines did say he would come back and let us know as they negotiate. Bahamians view that as totally unacceptable Mr. Deputy Speaker. So, Mr. Deputy Speaker, as I prepare to take my seat, I just would encourage Bahamians. I would encourage Bahamians to be aware of your health, to do your endeavor best to make some lifestyle changes, make dietary changes, Mr. Deputy Speaker. Sometimes when we hear the word obese, we think that it's a 400, 500-pound person. That's not the case. That is not the case. And I think, too, that's another form of education because, when I was younger, you would think to yourselves because you just was ignorant of the fact. You think a slim fella can't have a heart attack because, you thought of that to be a big person. But, the reality of it is if you're living a certain type of life, anybody can have a heart attack. It doesn't matter the physical structure of somebody. And so, you have a lot of these misconceptions, Mr. Deputy Speaker, but just some changes. I see now on, you go to restaurants, you can get sweet potato fries versus the regular fries, right? Okay? And while the sweet potato fries have more nutrients, the truth is, if you fry the regular fries and fry the sweet potato fries, you're negating some of the nutrients on the sweet potato fries. So again, and for some people that's a frustrating experience, Mr. Deputy, but the point is, these decisions are a matter of life and death, Mr. Deputy Speaker. And Mr. Deputy Speaker, I pray that Almighty God continues to provide wisdom for our people as it relates to this issue of non-communicable diseases and their lifestyles and behaviors and how it affects their daily lives. And St. Barnabas supports these compendium of bills. Thank you very much.
Thank you, Honorable Member. As many, the chair recognize the Honorable Member for Marathon. Well,
Madam Speaker, I rise in this honorable place on behalf of the constituents of Marathon. And first, let me start by saying, Madam Speaker, I want to extend my condolences to the legal fraternity in the Bahamas, and by extension to the family of attorney Sabrina Delavo, who was one of my colleagues. She went to sleep last night, didn't wake up this morning. And so I would like to extend my condolences to her family. Also, I would like to extend condolences to the family of Rudy Ferguson, my constituent from Union Village. He's being buried this weekend at Annex Baptist. And also, I would like to extend my condolences to Mr. James Strawn. He's always sit in that seat in the back there every Wednesday. He comes to see me and the Prime Minister, who was his classmate. So he passed away. So my condolences. So we're going to miss Mr. Strawn. And so, Madam Speaker, also, I would like to recognize some, I would call them important people because they came here today just to listen to this debate. That's Mrs. Jeanette Houghton and Mr. Kendall Carroll. Mr. Brown, he is an honorary member of the House of Parliament, and Mr. Daniels. So I want to thank you for being here and supporting this. Madam Speaker, I'll never forget the afternoon of father from my constituency, that was about a year ago, came to the office with tears in his eye and a brown paper bag under his arm with expired medications. And he said that, Ms. Raming, I don't have any choice. Even when I go to see the doctor again, I cannot afford the prescription. I can't afford to get worse. And Madam Speaker, I realized that that man didn't come looking for pity. He came looking for help. He came looking for a solution. And I can say it's this government, the Davis administration, that lives by the mantra that we are leaving no one behind. And that is why we are here today. Madam Speaker, meeting that young man in that position stayed with me from then to now. And that is why, along with many other reasons of why I really wanted to be a part of this debate. Not just as a parliamentarian, but as a woman, as a mother, and a daughter of a mom who's troubled from time to time with sciatic nerve pains and the cost of the medication. And I certainly thank Dr. Davel always for his expertise, his directions, and that he gave us in seeking help for her. And so while she's from time to time still battle with it, we can just pray to God that one day it goes away for good. And Madam Speaker, this debate is about whether we as a country will fix a healthcare system that has left too many people, too many Bahamians behind for a very long time. It is about whether this parliament will pass laws that give people, Bahamian people, a fighting chance at life. And it is about whether this generation of leaders is prepared to do what others were afraid to do or just lazy to do. The Davis administration has made its position known. We do not believe that health care should be a privilege reserved for the wealthy, the well-connected, or the lucky few. We believe that health care is a basic right, and my colleagues, Dr. Davel, would have indicated that. And this compendium of health bills is our plan to secure that right for every Bahamian, from Baintown to Bimini. Madam Speaker, what the Prime Minister promised, we are now delivering. And under the leadership of Dr. Michael Davel, who of course is the Honorable Minister for Tall Pines, we are not simply improving the Ministry of Health. We are rebuilding it from the ground up. And Madam Speaker, no one can dispute the facts. When we came to office, we found a broken system. Clinics that have not been maintained in decades, despite the complaints from the opposition today. Laws that hadn't been updated in a generation. Patients waiting weeks for basic screenings. And people dying of conditions that are manageable in a modern country. For 5 years under the last administration, healthcare policy was stuck in neutral. They gave speeches, and now today, we're here delivering results. And Madam Speaker, the proof is in front of us now. 5 bills that form the strongest and most forward-looking health reform package in Bahamian history. Madam Speaker, the first, which is the National Health Insurance Bill, this legislation does what the former 2016 Act failed to do. It provides legal certainty, financial stability, and modern oversight. It defines what every Bahamian is entitled to: free primary care, cancer screenings, maternal and pediatric care, and diagnostic services. Isn't this a good thing? Not for one, but for all. Madam Speaker, what we do know is that over 161,000 persons are already enrolled in the National Health Insurance. This health insurance was introduced by the Progressive Liberal Party. This demonstrates 95% of the public support. If you want to argue against this bill, you are not just arguing against this government, you are arguing against the Bahamian people themselves, especially those who need this, not those who want this, those who need this. There is a starking difference. Madam Speaker, this bill creates clear governance structures, enforces transparency in funding, and finally, allowing the authority to control quality and access in a way that benefits both the patient and the provider. The question is not whether we can afford to do this. The real question is whether we can afford not to do this. But I say to you, the Davis administration, my government, your government, the country's government, see the urgency by ensuring that this is done. Madam Speaker, the National Health Insurance Specified Chronic Diseases Prescription Drug Fund bill. This bill is about survival. We have over 40,000 Bahamians on the NIB chronic disease drug plan, and as stated earlier, more than 161,000 on the NHI plan. Until now, they have operated as two separate systems, which meant duplication, confusion, inefficiency, and inequality. It has also meant that there were two lines, two claim forms, and too many people falling through the cracks. This legislation integrates the system. They become married. One entry point, one platform, one national formulary, one level of dignity for all. Madam Speaker, a diabetic patient on Elutra shouldn't have to beg for insulin while another patient in Nassau gets automatic access. This bill fixes that. It makes access equal, efficient, and enforceable. Madam Speaker, the Health Promotion and Wellness Bill is an essential national strategy. We are in a public health crisis, and all of my colleagues would have indicated that. Who would have debated this bill? Obesity, hypertension, diabetes, and depression. These are not just numbers in a report. These are real. They are daily realities at every household in Marathon and in the wider Bahamas. Madam Speaker, this bill targets the root causes. It empowers the Minister of Health to lead a coordinated national response to unhealthy food, poor environments, and a culture that has ignored prevention for so long. It also gives the ministry the authority to regulate harmful imports and ban dangerous additives. The point is this: we are not waiting for people to get sick. We are building a Bahamas that stays well. Madam Speaker, the Dental Profession Bill, it creates proper licensing for dentists, dental nurses, hygienists, assistants, and therapists. It mandates for there to be a continuing of education. And why is this important? Because it protects patients from untrained practitioners. And it ensures that every Bahamian can access safe, regulated health care, whether it's in New Providence, the Family Islands, or even just in a public school program. Madam Speaker, as indicated by my colleagues, poor oral health is linked to cardiovascular disease, diabetes, stroke, and pregnancy complications. This bill is about protecting lives, not just your teeth. As the great member for Yamacraw. Madam Speaker, finally, the Pharmacy Amendment Bill. It recognizes electronic prescribing as legal, legitimate, and preferred. It integrates our e-prescribing system. And of course, it allows pharmacists to serve patients faster. And not only to my mind, but through logistics, our Family Island residents would find this extremely useful. Notwithstanding, it would be available for all. Madam Speaker, this is a fundamental step for the digital future of a healthcare system. It reduces errors, it eliminates lost prescriptions, and I'm sure most of us would have lost prescription before. and it gives our doctors and pharmacists the tools they need to deliver. Madam Speaker, the opposition, they stand here today, and they say that they support the health care bill, but they never act when they have the chance. They criticize the fine print. In some instances, they won't present an alternative, and if they do, it's never a feasible, workable alternative. It's always something that takes you over the edge. They will try to confuse the public with scare tactics, like we're headed in the wrong direction. But the record is clear, Madam Speaker. This government has done more in the 3 years to modernize healthcare than the former administration did in 5 years. And I listened to the member from Kalani, St. Barnabas, East Grand Bahama. They had much to say of what we should do and do this and build that. They had their moment. You squandered it. It's now our moment. And so we're doing this on behalf of the Bahamian people. We're also doing it on behalf of you.
Yes, it's for you, St. Barnabas.
We are doing the work, and Madam Speaker, I would end by saying marathon, support these bills.
Yes, yes, yes. Yes, well done.
Thank you, Honorable Member Asmini. The chair recognizes the Honorable Member for Freetown.
Thank you, Madam Speaker. Madam Speaker, let me begin shortly by confessing that I suffer from a non-communicable disease. In that, Madam Speaker, I suffer from hypertension, which I manage with medication. But, Madam Speaker, the story of me going on medication is one that is worth the telling. Madam Speaker, when I was a much younger lawyer thriving, I was borderline hypertensive, and my GP, my then GP, Dr. Kirkland Culmer, indicated that I could avoid medication if I were to change my lifestyle of late hours in the office, a hectic court schedule, and all else that I was doing. Also indicating, Madam Speaker, that I had to lose some weight, which at that time I did. I escaped medication on that occasion. But, Madam Speaker, my schedule did not change, and I ended up back again. And Dr. Culmer determined that regardless of all of my good intentions, my lifestyle would not change sufficiently, and I began to manage hypertension with medication. I say that, Madam Speaker, not because it's an admirable thing, because it's not, but because it defines what I think the member for Tall Pines has eloquently set out. And it also defines, Madam Speaker, a lot of the pitfalls that the side opposite would seek to set, not for us, but for the Bahamian people, because they never are talking to us. And they make it quite clear that they're always talking to the Bahamian people. And in my view, they falsely claim that they're talking for the Bahamian people, but they're always talking to the Bahamian people. And so the pitfall that they set for the Bahamian people, Madam Speaker, is to seek to lull them in to not taking personal responsibility on any issue. Madam Speaker, my confession at length is one that I acknowledge that I must take personal responsibility for suffering from a non-communicable disease and controlling it by medication with all of the attendant risk that the doctors tell me and all of us that it entails. And why is that dangerous, Madam Speaker? It is as dangerous as the negative mindset that the politicking tactic of the side opposite leads to. Madam Speaker, there is an adjunct professor of psychiatry at the Psychiatry and Behavioral Sciences at Stanford University, Dr. David Burns, and he did a study. And the study was designed to determine whether negative thoughts cause negative feelings, depression, or did depression cause negative thoughts. That was the second proposition they were testing. The third proposition they were testing is whether the negative thoughts and feelings influenced each other in a rapid circular feedback loop. And fourthly, they were testing whether negative thoughts and feelings do not affect each other, and instead there was some third factor. And after a test which was confirmed, and this is published in Psychology Today, they determined that it was negative thoughts more predominantly that cause negative feelings that could lead to depression, and depression could lead to suicidal ideations. Madam Speaker, reading the crime reports that the police send me, there is an alarming increase in suicides in this country. Alarming. And one must consider whether it's the propagation of negativity that is having an impact on it. When I was raised, we used to say, you always look on the bright side of life. And we had very little. And if you had 8 people sleeping in one bed, and you were the one who wet the bed, you would be happy that they mightn't be able to tell who wet the bed. So you look at the bright side of everything that happened in life. But Madam Speaker, there is a drive to focus on the negative, and Yamakra pointed it out. You focus on the negative when a Minister of Health repairs or rebuilds 40 clinics, and you are focusing on the ones that he is getting to now. You focus on negativity when a Minister of Health expands services, and you are focusing on small logistical issues. You're focusing on negativity, Madam Speaker, when you take the opportunity to take a picture of the garbage the minute it is full, not when it is empty, not when it is half full, but when it is full, and project that as a constant thing. That is focusing on negativity, because you're taking matters out of context. And let's be fair, Madam Speaker, many things will depend on how you look, and I don't mean any offense or anything ill to any of our young ladies, but I always tell them, we have some women of the African persuasion who will be concerned about lightening their skin, while people of the Caucasian persuasion spend a lot of money to tan, to turn their skin darker. When we have people of the Caucasian persuasion putting volumizers in their hair to make it thicker, like African hair. When we have persons of the Caucasian persuasion injecting collagen in their lips to make them bigger like persons of African descent. Clearly, if you're of African descent and you're seeking to reverse the very things that persons of Caucasian descent are trying to acquire, you are looking at them as negative attributes when someone else is looking at them as positive attributes. And so that tells you, Madam Speaker, that we have to be careful as an opposition, we have to be careful as people, whether or not we are participating in a national negative thinking campaign. Now, Madam Speaker, it is disturbing that the member for Tall Pines worked very hard on this compendium, and the member for East Grand Bahama said that these bills don't go far enough when they didn't go anywhere at all. That is like saying, Madam Speaker, that I fell at the 25th mile mark of a marathon, and somebody who was sitting on the sideline saying, I could have gone further. They didn't go one step of the way. So the member for Tall Pines, by this compendium, has gone infinitely further than they have gone. And so it is not a criticism to say you could have gone further when you couldn't do anything. And marathon is 4.5 years. They couldn't even go 5 years. And so, Madam Speaker, one must be careful of that, because if you get a national psyche, it may be difficult to dispel. And so I caution the opposition and others who seek to project negativity in this country. But, Madam Speaker, their arguments do not even stand logical scrutiny. On the one hand, they say the member for Tall Pines and this administration isn't going far enough, that we should include other things. And then the member for Kalani and East Grand Bahama says they're not sure that with the existing infrastructure, the member for Tall Pines can even be able to do what he set out in these bills. But they criticize to say they don't go far enough. And so if you don't think and are confident that it's going to manage what you have now, how can you be arguing to go further? Surely you should work out the 100 meters before you go to the 200, eh? And so you can't be complaining that he went 100 meters and you didn't go anywhere. And you definitely can't say you don't think he has what it takes to go 100 meters, but say he should be going 200. We are not perfect, Madam Speaker. I don't believe the member for Tall Pines think he is perfect. Anyone who thinks they're perfect needs their head examined.
Let me check my head.
And so, Madam Speaker,
Let me check my head.
there will be missteps, but the measure of that is how you respond to any failings that you find. But we will not be deterred, Madam Speaker, for doing what we think will improve the lot of Bahamians. And very quickly, Madam Speaker, isn't it something that Kalani says he supports the breakfast program, but it should include lunch and a snack? Seriously. Seriously. They didn't have a program that provide any student, the general student population, with breakfast one day out of the week. But it should include lunch and a snack. And they have the heart to say a healthy snack when they was beating us over our head with a list of unhealthy food for about 3 or 4 years. The final point I will make, Madam Speaker, because the other speakers have covered it, is this. East Grand Bahama says basically that the health promotion and wellness bill is really not necessary, because Dr. Darwell could do everything that's in the bill. He can do that now. Well, some of it is true. It can be done now, Madam Speaker, but I would invite the public to read this bill, which is available free online. And the difference is a Minister of Health can, before this bill, choose to do certain things. After this bill, Madam Speaker, they will have to do some things. Yes. And that is because the bill contains, as lawyers we say, mandatory language. And it's obvious. The section 4 says that the minister shall cause a health promotion and wellness plan to be created. He don't have a choice. He shall do it. And it says the plan must, not may, must. And it says what the plan must do. You see, if Dr. Culmer told me and I had the ability to say, you must reduce your workload, you must do this, you must do that, I wouldn't be hypertensive today. But he doesn't have that ability. This won't permit doctors to hold people at ransom like that. But the point is, Madam Speaker, that there's a difference between you can do something and you shall do it. And it says the Ministry of Health and Wellness shall allocate sufficient funds and resources for things. It says that the objective for health education and promotion shall seek. And so I would ask the public to read this act and see what this government is mandating, not just this Minister of Health, but every Minister of Health and Wellness while this bill is still the law to do. Now, the other side is a crew of stop, review, and cancel. And at the event, the linked up event on Monday, I pointed out that scripturally, you can find the stop, review, and cancel people. And I am not going to read it, Madam Speaker. I'm going to cause people to go and get their Bible or use their phone to read it. You can get it in a very PLP scripture, Madam Speaker, in the Gospel of John, chapter 10, and verse, guess what? 10. 10:10. You can find what the Bible would set up of the people who would stop, review, and cancel. The Health Promotion and Wellness Bill. Dr. Darville is perhaps a prophet to seek to secure against any possibility. And it mandates you have to do these things. And the fact that East Grand Bahama and the opposition does not see the difference or appreciate the difference between you may do something and you have to do something speaks volumes about their analytical ability in terms of the legislation and the policy that we put. And it probably explains why they did precious little in 4.5 years. So, Madam Speaker, with that, Freetown supports this compendium of bills.
That's it. Thank you, Honorable Member. The Chair recognizes the Honorable Member for Golden.
Madam Speaker, I move that this House does continue beyond the 7 o'clock hour.
Thank you, Honorable Members. It has been moved and seconded that the business of this House proceed beyond the 7 p.m. hour. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. The business of this House will proceed beyond the 7 p.m. hour. It has been moved and seconded that the following bill be read a second time and committed. For an act to continue the National Health Insurance Plan and Fund established and existing under the National Health Insurance Act 2016, to extend the benefits under the plan and to provide as a minimum standard health benefits and other benefits to persons presently enrolled in the plan and to persons eligible and enrolled after the commencement of this act. To validate all acts done under the existing plan and fund, to repeal and replace the National Health Insurance Act 2016 and for connected purposes. As many are in favor, will remain seated. Those opposed will stand. Order that the bill be read for a second time and committed.
A bill for an act to continue the National Health Insurance Plan and Fund established and existing under the National Health Insurance Act 2016, to extend the benefits under the plan and to provide as a minimum standard health benefits and other benefits to persons presently enrolled in the plan and to persons eligible and enrolled after the commencement of this act, to validate all acts done under the existing plan and fund, to repeal and replace the National Health Insurance Act 2016 and for connected purposes.
Thank you. Further second readings? The chair recognizes the honorable member for Golden Gates.
Madam Speaker, I move for the second reading of the National Health Insurance Specified Chronic Diseases Prescription Drug Fund Bill 2025.
Thank you, honorable members. It has been moved and seconded. It's been moved and seconded that the following bill be read for a second time and committed. A bill for an act to repeal the National Insurance Chronic Disease Prescription Drug Fund Act, Chapter 350A, and to provide for the establishment of a new fund under the control and management of the National Health Insurance Authority to supply patients suffering from specified chronic diseases with safe, effective, and economical prescription drugs and medical supplies, and to improve the accessibility to and affordability of prescription drugs and medical supplies. As many are in favor, will remain seated. Those opposed will stand. Order that the bill be read for a second time and committed.
A bill for an act to repeal the National Insurance Chronic Disease Prescription Drug Fund Act, Chapter 350A, and to provide for the establishment of a new fund under the control and management of the National Health Insurance Authority to supply patients suffering from specified chronic diseases with safe, effective, and economical prescription drugs and medical supplies, and to improve the accessibility and affordability of prescription drugs and medical supplies.
Thank you. For the second reading of bills?
Madam Speaker, I move for the second reading of the Pharmacy Amendment Bill 2025.
Thank you, honorable member. Thank you, honorable members. It has been moved and seconded that the following bill be read a second time and committed. A bill for an act to amend the Pharmacy Act. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. Order that the bill be read for a second time and committed.
A bill for an act to amend the Pharmacy Act.
Thank you. Further second readings?
Madam Speaker, I move for the second reading of the Dental Professions Bill 2025.
Thank you, honorable member. Thank you, honorable member. It has been moved and seconded that the following bill be read for the second time and committed. A bill for an act to repeal the Dental Act, Chapter 226, and the replacement thereof, to provide for the continuation of the Dental Council, to provide for the registration and licensing of dentists and dental auxiliaries, to provide for continuing education, to regulate the practice of dentistry, and for connected matters. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. Order that the bill be read for a second time and committed.
A bill for an act to repeal the Dental Act, Chapter 226, and the replacement thereof, to provide for the continuation of the Dental Council, to provide for the registration and licensing of dentists and dental auxiliaries, to provide for continuing education to regulate the practice of dentistry and for connected matters.
Thank you. Further second readings?
Madam Speaker, I move for the second reading of the Health Promotion and Wellness Bill 2025.
Thank you. Thank you, honorable members. It has been moved and seconded that the following bill be read for a second time and committed. A bill for an act to promote healthy lifestyles and wellness, to empower the adoption of national, regional, and global public health policies to reduce the incidence of non-communicable diseases and premature death linked to unhealthy food consumption and harmful lifestyle behaviors, and for matters connected thereto. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. Ordered that the bill be read for a second time and committed.
A bill for an act to promote healthy lifestyles and wellness, to empower the adoption of national, regional, and global public health policies to reduce the incidence of non-communicable diseases and premature deaths linked to unhealthy food consumption and harmful lifestyles behaviors, and for matters connected thereto.
Thank you. For the second readings?
Madam Speaker, no more second readings. Therefore, I now move that the House do resolve itself into the Committee of the Whole with the member for North Abaco in the chair.
Second.
Thank you, honorable members. It has been moved and seconded that the House do now resolve itself into the Committee of the Whole with the honorable member for North Abaco in the chair. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. The House will now resolve itself into the Committee of the Whole with the honorable member for North Abaco in the chair. Not this chair. You thief my mace. Not this. Not this. I don't pass it, but I won't forget it. No. Let me give it to you to be the speaker next time.
Committee of the Whole.
Mr. Chair, I move that the long title of the bill, the National Health Insurance Bill 2025, be agreed.
Second.
It has been moved and seconded that the long title of the bill be agreed. As many as in favor will remain seated, and those opposed will stand. The long title of the bill has been agreed.
Mr. Chair, I move that the short title of the bill be agreed.
Second.
It has been moved and seconded that the short title of the bill be agreed. As many in favor will remain seated. Those opposed will stand. The short title of the bill has been agreed.
Mr. Chair, I move that clauses 2 through 64 of the bill be agreed.
Second.
It has been moved and seconded that clause 2 through 64 of the bill be agreed. As many are in favor will remain seated. Those opposed will stand. Clause 2 to 64 of the bill has been agreed.
Mr. Chair, I move that first, second, and third schedules of the bill be agreed.
Second.
It has been moved that first, second, and third clause of the bill, schedule of the bill, be agreed. As many are in favor will remain seated. Those opposed will stand. It is agreed that schedule 1, 2, and 3 of the bill be agreed.
Mr. Chair, I move that the National Health Insurance Bill 2025 in its entirety is agreed.
It has been moved and seconded that the bill to its entirety be agreed. As many are in favor will remain seated. Those opposed will stand. The bill to its entirety is agreed. In its entirety is agreed.
Mr. Chair, I move that the National Health Insurance Specified Chronic Diseases Prescription Drug Fund Bill 2025, long title, be agreed.
It is It has been moved and seconded that the long title of the bill be agreed. As many are in favor, will remain seated. Those opposed will stand. It is agreed that the long title of the bill be, the long title is agreed.
Mr. Chair, I move that the short title of the bill be agreed.
Second.
It has been moved and seconded that the short title of the bill be agreed. As many as in favor will remain seated, and those opposed will stand. The short title of the bill is agreed.
Mr. Chair, I move that clauses 2 through 15 of the bill be agreed.
Second.
It has been moved and seconded that clauses 2 through 15 of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. It is agreed that clause 2 through 15 of the bill be agreed.
Mr. Chair, I move that first and second schedules of the bill be agreed.
Second.
It has been moved and seconded that first and second clause of the bill be agreed. Schedule of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. It is agreed that it has been agreed that the first and second schedule of the bill be agreed.
Mr. Chair, I move that the National Health Insurance Specified Chronic Diseases Prescription Drug Fund Bill 2025 is in its entirety be agreed.
Second.
It has been moved and seconded that the bill to its entirety be agreed. In its entirety be agreed. Those in favor will remain seated. Those opposed will stand. The bill in its entirety is agreed.
Mr. Chair, I move that the Pharmacy Amendment Bill 2025 long title be agreed.
Second.
It has been moved and agreed.
Seconded.
Moved and seconded that the long title of the bill be agreed. As many as in favor will remain seated. Those opposed will stand.
No, they already done.
Watch the road.
No. I just would do short title. Mr. Chair, I move that the short title of the bill be agreed.
Second.
It has been moved and seconded that the short title of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. The short title of the bill is agreed.
Mr. Chair, I move that clause 2 of the bill be agreed.
Second.
It has been moved and seconded that clause 2 of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. Clause 2 of the bill is agreed.
Mr. Chair, I move that the Pharmacy Amendment Bill 2025 in its entirety be agreed.
Second.
It has been moved and seconded that the bill in its entirety be agreed. As many as in favor will remain seated. Those opposed will stand. The bill in its entirety has been agreed.
Mr. Chair, I move that the Dental Professions Bill 2025 long title be agreed.
Second.
It has been moved and seconded that the bill long title be agreed. As many as in favor will remain seated. Those opposed will stand. The bill long title is agreed.
Mr. Chair, I move that the short title of the bill be agreed.
Second.
It has been moved and seconded that the short title of the bill be agreed. As many as in favor will remain seated, and those opposed will stand. The short title of the bill is agreed.
Mr. Chair, I move that clauses 2 through 49 of the bill be agreed.
Second.
It has been moved and seconded that clauses 2 through 49 of the bill be agreed. As many as in favor will remain seated, those opposed will stand. Clauses 2 through 49 is agreed.
Mr. Chair, I move that the Dental Professions Bill 2025 in its entirety be agreed.
Can I get a second?
Second.
It has been moved and seconded that the bill in its entirety be agreed.
Where it is?
Okay. As many as in favor will remain seated.
Where? Not on here? Where are they? Move that schedules 1 through 4 of the bill be agreed.
Second.
It has been moved and seconded that Schedule 1 through 4 of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. Schedule 1 through 4 of the bill is agreed.
Mr. Chair, I move that the Dental Professions Bill 2025 in its entirety be agreed.
Second.
It has been moved and seconded that the bill in its entirety be agreed. As many as in favor will remain seated. Those opposed will stand. The bill in its entirety has been agreed.
Mr. Chair, I move that the Health, Promotion, and Wellness Bill 2025 long title be agreed.
Second.
It has been moved and seconded that the long title of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. The long title of the bill
No.
is agreed.
Mr. Chair, I move that the short title of the bill be agreed.
Second.
It has been moved and seconded that the short title of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. The short title of the bill is agreed.
Mr. Chair, I move that clauses 2 through 20 of the bill be agreed.
Second.
It has been moved and seconded that clauses 2 through 20 of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. Clauses 2 through 20 of the bill is agreed.
Mr. Chair, I move that the schedule of the bill be agreed.
Second.
It has been moved and seconded that the schedule of the bill be agreed. As many as in favor will remain seated. Those opposed will stand. The schedule of the bill is agreed.
Mr. Chair, I move that the Health, Promotion, and Wellness Bill 2025 in its entirety be agreed.
It has been moved and seconded that the bill in its entirety be agreed. Those are in favor will remain seated. Those opposed will stand. The bill in its entirety is agreed.
Mr. Chair, I move that the Speaker do now take the chair.
It has been moved. Can we have a seconder? Second. It has been moved and seconded that the Speaker now take the chair. As many as in favor will remain seated, and those opposed will stand. The motion is carried. The Speaker will now take the chair. No amendments? Oh. Better get there. Yes, sir. Yeah, I have it. Yeah. Oh, Jesus. Honorable Madam Speaker, I beg leave to report that the Committee of the Whole has examined the several bills, having made no amendments thereto.
Honorable members, the Honorable Member for North Abaco and Chairman of the Committee of the Whole has reported that the committee has examined the bills, having made no amendments thereto. Third readings?
Madam Speaker, I move for the third reading and passing of the National Health Insurance Bill 2025.
Second.
It has been moved and seconded that the following bill be read for a third time and passed. A bill for an act to continue the National Health Insurance Plan and Fund established and existing under the National Health Insurance Act 2016, to extend the benefits under the plan and to provide as a minimum standard health benefits and other benefits to persons presently enrolled in the plan and to persons eligible and enrolled after the commencement of this act, to validate all acts done under the existing plan and fund, to repeal and replace the National Health Insurance Act 2016 and for connected purposes. As many are in favor will remain seated. Those opposed will stand. The motion is carried. Ordered that the bill be read for a third time and passed.
A bill for an act to continue the National Health Insurance Plan and to fund established and existing under the National Health Insurance Act 2016, to extend the benefits under the plan, to provide as a minimum standard health benefits and other benefits to persons presently enrolled in the plan, and to and to persons eligible and enrolled after the commencement of this act, to validate all acts done under the existing plan and fund, to repeal and replace the National Health Insurance Act 2016, and for connected purposes.
Thank you. Order that this bill do now pass and the title thereof declared to be National Health Insurance Act 2025. Further third readings?
Madam Speaker, I move for the third reading and passing of the National Health Insurance Specified Chronic Diseases Prescription Drug Fund Bill 2025.
Second.
Thank you, honorable members. It has been moved and seconded the following bill be read for a third time and passed. A bill for an act to repeal the National Insurance Chronic Diseases Prescription Drug Fund Act, Chapter 350A, and to provide for the establishment of a new fund under the control and management of the National Health Insurance Authority to supply patients suffering from specified chronic diseases with safe, effective, and economical prescription drugs and medical supplies, and to improve the accessibility to and affordability of prescription drugs and medical supplies. As many are in favor will remain seated. Those opposed will stand. The motion is carried. Order that the bill be read for a third time and passed.
A bill for an act to repeal the National Insurance Chronic Disease Prescription Drug Fund Act, Chapter 350A, and to provide for the establishment of a new fund under the control and management of the National Health Insurance Authority to supply patients suffering from specified chronic diseases with safe, effective, and economical prescription drugs and medical supplies, and to improve the accessibility to and affordability of prescription drugs and medical supplies.
Thank you. Order that this bill do not pass and the title thereof declared to be National Health Insurance Specified Chronic Diseases Prescription Drug Fund Act 2025. Further third readings?
Madam Speaker, I move for the third reading and passing of the Pharmacy Amendment Bill 2025.
Second.
Thank you, honorable members. It has been moved and seconded that the following bill be read for a third time and passed. A bill for an act to amend the Pharmacy Act. As many are in favor will remain seated. Those opposed will stand. The motion is carried. Order that the bill be read for the third time and passed.
A bill for an act to amend the Pharmacy Act.
Thank you. Order that the bill do not pass and the title thereof declared to be Pharmacy Amendment Act 2025. Further third readings?
Madam Speaker, I move for the third reading and passing of the Dental Professions Bill 2025.
Second.
Thank you, honorable members. It has been moved and seconded the following bill be read for a third time and passed. A bill for an act to repeal the Dental Act, Chapter 226, and the replacement thereof, to provide for the continuation of the Dental Council, to provide for the registration and licensing of dentists and dental auxiliaries, to provide for continuing education, to regulate the practice of dentistry, and for connected purposes. As many are in favor will remain seated. Those opposed will stand. The motion is carried. Order that the bill be read for a third time and passed.
A bill for an act to repeal the Dental Act, Chapter 226, and the replacement thereof, to provide for the continuation of the Dental Council, to provide for the registration and licensing of dentists and dental auxiliaries, to provide for continuing education, to regulate the practice of dentistry, and for connected matters.
Thank you. Order that this bill do not pass and the title thereof declared to be Dental Professions Act 2025. Further third reading?
Madam Speaker, I move for the third reading and passing of the Health Promotion and Wellness Bill 2025.
Thank you, honorable members. Is there a seconder? Thank you, honorable members. It has been moved and seconded that the following bill be read for a third time and passed. A bill for an act to promote healthy lifestyles and wellness, to empower the adoption of national, regional, and global public health policies to reduce the incidence of non-communicable diseases and premature death linked to unhealthy food consumption and harmful lifestyle behaviors and for matters connected thereto. As many are in favor, will remain seated. Those opposed will stand. The motion is carried. Ordered that the bill be read for a third time and passed.
A bill for an act to promote healthy lifestyles and wellness, to empower the adoption of national, regional, and global public health policies, to reduce the incidence of non-communicable diseases and premature death linked to unhealthy food consumption and harmful lifestyle behaviors, and for matters connected thereto.
Thank you. Ordered that this bill do now pass, and the title thereof declared to be Health Promotion and Wellness Act 2025. Further third readings?
Madam Speaker, there are no further third readings.
Thank you, Honorable Member. Ordered that the clerk do take the bills passed by the House today to the Honorable Senate for their concurrence. We will now revert back to the order of business. Consideration of Senate amendments, resolutions, member statements, appointment of select committees, instruction to select committees, discharge of select committees, notices for future meetings. The chair recognizes the honorable member for Golden Gates.
Yes, Madam Speaker, I rise to give notice to renew all matters in the name of the members of the government.
Thank you, honorable member. Now, Mr. Balmas, you could act in this capacity.
I rise to renew all notices in the name of the opposition, Madam Speaker.
And I'd like to take this time, I know the honorable member for St. Anne's is normally there for government business, opposition business, right? And I'd like to wish him a very happy birthday, seeing that none of the members on the side opposite did it today. Very happy birthday to my friend, St. Anne's, the honorable member for St. Anne's. I hope he's celebrating. That's sad. Adjournment?
Speaker, I move that this House, at its rising, do adjourn to our final session of the summer, which will be 10 a.m. on the 6th of August, 2025. Please mark your calendar.
Okay.
Second loud.
May I have a seconder? It has been moved and seconded that the House, at its rising 6th of August 2025 at 10 a.m., the House will now adjourn to its rising on 6th of August 2025 at 10 a.m. As many are in favor will remain seated. Those opposed will stand. The motion is carried. Final adjournment?
I move that the House do now adjourn.
Thank you. Thank you, honorable members. It has been moved and seconded. The House do now adjourn to Wednesday, 6th of August, 2025 at 10 a.m.
All right.